There you go. All right, well, we do have quorum today. Yay, thank you all for being here. I know Teresa is on her way, and Kay is joining us online. 5, 6, 7, and Paula is not joining us as a committee person today. She's joining us at her interview times. So that means we're here. We've got a quorum. So let's move forward. All right. So I would like to call to order the Public Health and Community Services Committee meeting today, October 31st at 8:34. Roll call, please.
Von Bergen.
Here.
Yensen. Schwartz.
Here.
Jindrak.
Here.
Schofield.
Here.
Meshes. Bates.
Yes, here.
Parrish.
Here. And then I think we need to, can I get a motion to accept Kay joining us via WebEx this morning? Awesome. Carolyn and Tanya. All those in favor?
Aye.
Aye.
Great, thank you. All right, minutes for approval, Public Health and Community Services meeting, September 29th. Can I get a motion for minutes? Tanya, Carolyn? Any discussion, questions, changes? All righty, seeing none. All those in favor?
Aye.
Anyone opposed? Okay. Any public comment?
No offense.
Are which there back in the corner? Do you have an apple for us today?
No.
She does have
Oh,
an
it is
apple.
You don't know who it is, do you?
Oh my
do?
gosh.
Okay.
It is a person. Okay, I did
It's Melissa.
Yeah.
Good job.
Ooh, that
I didn't
is.
even look at the costume, I just walked right by.
All righty. No public comment. Members' comments. No. A bush falls over the crowd. Okay. I'm going to save mine for the end. So, new business. All right, we have many interviews this morning. We have a couple for the Board of Health, several for the Mental Health Board, and one for Senior Services Grant Commission. I'd like to alert the committee to Molly Dolan will not be interviewing at 10 o'clock today. She has decided to withdraw. And everyone else is scheduled and planning to attend. Some are WebEx and some are in person. So I see Dr. Katz is with us. Good morning, Melissa.
Hi there. How are you all? Happy Halloween.
Happy Halloween. Thanks for being here. Thanks for coming back.
Thanks for having me.
All right, so we know each other, but I will introduce you or introduce myself as chair of the Public Health and Community Services Committee, and we're glad you're here, and thank you for your interest in the Board of Health. And we'd like for you to just take a few moments to introduce yourself, tell us about yourself, maybe share why you're interested on being part of the Board of Health, and then we'll open it up to questions from the committee. How does that sound?
That sounds great. Thank you. And you can hear me okay?
Yes.
Okay, perfect. So I want to thank you all for having me today. I know that you're going to spend some time with a lot of people this morning who are applying for these sort of unique positions in the county. So I'm grateful for the time that you're spending with me, and I thank you. I am interested in the Board of Health after attending the Community Health Assessment results presentation at McHenry County College a couple of weeks ago, and learning that the top 3 sort of concerns in our county as presented in the results were mental health, obesity, and diabetes. So I'm a licensed clinical psychologist, and I come with a background of integrating sort of mental health into the physical health world. And actually, when I was at Sinai Children's Hospital, I was really instrumental in creating programs for actually the obesity clinic and the diabetes clinic that they run there for kids. So we brought in some of our behavioral health model and we integrated that into the medical model. I also am a founding member of a youth community alliance. It's called the Youth Empower Alliance. And we have sort of broken down silos, if you will, within the organizations in our county that serve children. It's sort of, the organization is very consumer driven. We're listening to children and we're asking them sort of what they're hoping for in the community, and then we're driving programming and service and events to sort of tailor around them. So I think the combination of sort of my background as a psychologist and my community collaboration and just the specific needs in the community at this time sort of piqued and sparked my interest in wanting to be here today. I also want to share that my husband's Mexican, and so I'm raising two children. We're raising two children who are a significant part of that minority culture that we heard about in the assessment, and it hits me personally, so I'd like to be able to engage in conversations and have a seat at the table, if you will, for services and populations that sort of fit me personally.
Thank you. Alrighty, thanks for sharing, Melissa. I appreciate it. Any questions from the committee members?
I have one question.
Sure.
When applying, would she be interested in would you be interested in the 3-year term to the 2025, or do you have a preference? It looks like one is June 2025 and the other one is June 30th of 2023.
Yeah, I haven't thought about that. I don't think I would have a preference. I am just, excited and encouraged to be a part of it. I'm hesitant to commit to things very, very long term without having experience doing it, to be honest, but I think I'd be a really good fit for this board, and I'm sure, I'm here to help in this community, so I don't think I would be against a longer term.
Thank you.
I just wanted to say thank you for applying your qualifications, and I know we worked together a little bit, but I don't know if we've met in person. So I'm Carolyn Schofield, by the way, and so it just say thank you for bringing your knowledge and your professionalism to the table, and really knowing already. I mean, from the start, you're ready to go. So thank you.
Thank you for saying that. Nice to meet you too.
Any other questions, comments?
Well, I mean, I would just say that I have met Melissa in person, and I really find that your enthusiasm for serving the community is inspirational, and I appreciate you applying for this position.
Thank you.
Okay, well, I will echo that. Thank you for being here, and thank you for applying, and I'm excited for the opportunity to have your knowledge, expertise, and enthusiasm on the mental health board. So, Board of Health. You do other stuff with the mental health board, but Board of Health. This is for the Board of Health.
I'd love to liaison. I'd love to work with the mental health board, but
yeah, you're already figuring that out. We're doing that from a different arena. So yes, for the Board of Health, we're excited that you've applied for this position. So thank you very much, and we'll talk soon.
Okay, bye. Have a good rest of the day.
Thank you.
You too. Happy Halloween.
You too.
Thanks for keeping them together this time. Well, I had the opportunity.
Yeah.
Makes it
I mean, like all these notes of like who's
Right, who's
where,
where, yes,
and straight,
yes.
In a perfect world, that's how I like to see it.
Exactly. It's,
Yeah.
it's very nice.
Yeah.
I figured it was a challenge with all those people.
Yeah.
Lupe is coming in person, right?
Yes.
Okay. I wonder if she's here yet.
I think we'll take a look.
You're gonna take a look, okay.
So basically, we got two candidates for two positions.
Yes, sir.
Sort of
Just the time.
glad we got two candidates.
Yes, we're glad we got two candidates.
Right. We're still looking for a dentist. So.
Yeah, yeah, we still need a dentist.
I reached out to my dentist and
I did too.
Actually, I have a friend who's, but she already does like kind of non-profit. I don't see her, but let me double check my notes to make sure she's not on my list. Oh, there's somebody waiting.
Right, yes, yes.
Someone's waiting in the lobby. She confirmed for 8:50, she did not ask for WebEx.
Okay.
Oh, isn't that what they're on?
There is someone waiting on the WebEx, but they called in, so I can't see their name. All I can see is a phone number.
Yeah, that might be Kathy Ferguson. She was gonna call. Are you able to chat with those in the waiting room? I know on Zoom you can, to see. Sorry, or would you like me to? No. Okay.
Without letting them first.
Okay.
We can update it on here,
Mandy's gonna come in person.
Do you want me to let them in? We can verify who they are. We'll just
Back in
stick
there.
with the order that we have.
We can stick with the order that we have and
Yeah.
give Mandy should be here. She was early, last week, so Mandy's probably on her way if she gets here.
Yeah, and you feel free to start.
Yeah, I need to
Get somebody else. Running late.
Excuse me.
No, he's got his passport. So he did it.
well, it's passports have changed. Like my passport dates I have to show. Do you put a lot of cards away for storage?
No, I mean, just my own. I don't have any room to store credit. I had one customer that owned a 2-car store, and so my friend has a warehouse.
Yeah,
that he does that, so
So it's,
subcontractors to him, and then, I mark it up for my trouble, so it doesn't take up my space.
Sure. I'm sure you have all like needed storage for your personal.
Yeah. I have 35 cars myself.
Especially.
Every building has a color in the road, it's a 92 square foot coverage.
obviously, the price is getting real wide.
If someone
That was a
including the
Oh,
and I didn't, this is all the person, but it was like,
But maybe we could trade
it was,
parts.
right, that was,
I'm selling an
I
auction.
think it was,
Oh, yeah.
It ends in 4 hours.
Oh.
I don't think I'm gonna get my user.
No.
I think it's just, it should be done here.
I
I think so.
yeah.
Okay.
A lot of.
Thank you.
Yep.
That's my deal.
Okay.
I know I had to think about. I'm like, oh, it's Melissa. I had to think about who's in the.
I love it.
Yes. My husband went to, he's a professor, he went today as the plague doctor. And I said, do you, right, the big yes. And I said, do you think you're going to upset your students? He said, I'll take the mask off for teaching. Okay.
What age does he teach?
He's a professor, so they're mostly 18.
Oh, okay.
Yeah, adults.
We had one in our middle school, and he always dressed up as different
Yeah.
every year, and like that was his thing. And some years it
10
was
years
so
ago.
creepy.
Yes.
And like, and I was walking and they were like, don't come in here.
Well, the plague doctor is creepy to look at. It's intimidating.
Yeah, and they were
Yeah.
and I was just like, so.
Command your
And it
circle.
was really good, and then he'd do like a whole thing at his house. You
Yeah.
know, and it was really good. It's just a little too creepy. I don't like the gory part.
Yeah.
I love costumes, not the gore in my blood.
Yeah.
Additional
And my husband wasn't allowed to celebrate Halloween as a child. In fact, like on Halloween, his parents would send him to school but pick him up before the Halloween party. So that's how serious they were that he wasn't allowed to celebrate Halloween. And he loves candy and costumes. So like this is his favorite holiday. And he's making up. I think he'll wear a costume for the rest of his life.
Well, he had.
He'll be like 100 years old, still wearing some costume. When I said to my daughter, I was like, Mom, what are you going to be today? And I was like, I'll be you. She was like, you cannot be me today, Mom. I was like, fine, I'll be myself. Okay.
I would always dress up with my kid.
Yes.
All right, why don't we do this? Why don't we see who's in the waiting room, and since Guadalupe's not oh, she is here. Never mind. Hi, Lupe.
Hi.
Come on in.
Thank you. Thank you.
Good morning, everyone.
Good morning. All right, so excited to see you today. Thanks for being here. I'm Lori Parrish. We know each other.
We do.
Chair of the committee this morning, and so we're glad you're here. Thank you for applying for the Board of Health, and we'd love for you. We've seen your application, so thank you for that. If you can share a little bit with the committee about yourself and your interest for being on the Board of Health, and then we'll open it up to questions from the committee.
Okay, sounds great. So again, I'm Guadalupe. Either one is okay. I grew up in McHenry County, and I currently am serve our community through being executive director at Youth and Family Center, a non-for-profit here in our community. I've been in the non-for-profit field for over 10 years, but more importantly, I grew up in McHenry County. It's weird to think that I'm applying for this because I never thought, I don't have as you guys could see, I don't have a health background. But in my field and what I'm doing, I've learned that it's very much interconnected. And a lot of what I do outside of my role in Youth and Family Center is a lot of community development. I have a huge passion for our community being as involved as they can be, but also being super healthy and access to health is super important to me, and I believe that a lot of the lack of access to health is the lack of knowledge and education, and so that's a lot of what I do with my family, with my loved ones, with anyone that I encounter. Did you know that these resources are available in McHenry County? I think, I could use my voice in that way. I grew up here and I didn't know half of the county resources that were available. I wish I did when I was growing up for my parents, for myself. And so every day, I swear I learned something new about our county. I love McHenry County, and I just want everyone to feel happy here. I see a lot of people leave McHenry County, especially people my age, for various reasons, and I'm like, no, don't go. There's so many benefits to it, but so on the board, I think that I could bring in a different perspective. I met Melissa at the Healthy Community Study. First, I've always loved and been inspired by the Healthy Community Study. I was involved in the Healthy Community Study about 4 years ago, not this recent one, but the prior one with Youth and Family Center. We gathered a focus group together. I sat in that focus group and just seen the way people spoke when they had an opportunity to speak was really, really neat. And then everything that we learned, right? We meet people where they're at. Really neat perspective. So that was my first involvement with the Healthy Community Study. And then this year going and hearing the presentation to it. you know, my mind was going all these different directions of why, you know, these data points are the way they are. And I think that's the perspective that I could bring to the board, right? Clearly I don't have a health background, but my years of experience as being a community leader and working hands-on directly with clients that do have a lot of determinants of health, right? Education, low education level. Most of the people that we work with are low income. Mental health, we haven't even started with that. Really passionate about mental health. I started working with that as a business major, and little did I know that I could make such a big impact in the lives of youth that have been diagnosed with mental health by being a community support specialist. That was another thing, you know. One thing is treatment, and the other thing is having them utilize all the different resources that there is in our community. And so realizing that I could be an impact in their treatment by not even having a mental health background or not having a health background, by connecting them to the wonderful resources that there is, and the change that would happen with that. And so, you know, my years of experience I could bring in a perspective to the board, and my background with my family, who I struggle to be healthier. I've kind of taken the lead on that. Come from a family that is very obese, and so trying to be the pioneer to that and how to be healthier is another perspective that I can bring.
Thank you. Thank you. Any questions? What questions do the committee members have? Go ahead, Teresa.
So what ways do you see that the members of the Board of Health could reach out better to the community to let them know, right, what's going on? I agree with you that one of the barriers we have is people don't know how much we have for offering.
So this is something that I think we all struggle with, not just the Board of Health or the county. Every organization kind of struggles with this. So the recommendation, I always get asked this recommendation that I always have is obviously having materials in Spanish. Mm-hmm. I see that the county has done a lot better job with that. Also, what we've learned is access through like Facebook. I know our website is one thing, but Facebook is a really common area where people are utilizing, and just word of mouth and really connecting with them in their language. And then, you know, events that there may be, meeting our residents where they're at is really neat, and being approachable and having a lot of peer-to-peer. And so these community health workers, that was another huge project that we had with COVID. Peer-to-peer is where it's at. We hired, Youth and Family Center hired 4 community health workers that were out in the community, and they listen to Lupe, but if they listen to a peer that is just like them, you know, they spread the word way more than what I have been able to do. And I feel like I know a lot of people in the county, but they would reach, peer-to-peer would reach a lot. So educating and providing a lot of peer-to-peer opportunities, I think, would be, you know, and educating them in the different things that we have. Focus groups, I think, you know, I have a huge network with not-for-profits. I think there's a way in for focus groups. I would love to see the Healthy Community Study have more focus groups. If we reach out to our not-for-profits, we deal with them day to day, right, with our clients and with our residents. And so I think every not-for-profit would be more than happy to run a focus group for the populations that we serve. And so more focus groups like that would be another way to reach them.
Yeah, thank you. And I also thank you for applying. I think that you've been asked that.
Thank you very much.
Any other questions?
I just have the same question, because if you look at it, it says that the appointment, there's only one until June of 2023, and then there's the other one that's a 3-year term till June of 2025. Do you have a preference? I know some people have things in their future and they're not sure if they want to dip their foot in and see how they like it,
yeah.
Or if it's you have one or the other. Or
I would prefer the short one, just so I could have the option. I mean, I could reapply again. You know, this is my first opportunity. If I get the opportunity to sit on a board at this big, I sit on the chamber board, and obviously run our board at Youth and Family Center. But I would prefer the shorter one, just so I could get my feet wet and see what it would be like. But either one, I mean,
Okay, thank
yeah,
you.
any way that I can serve.
Thanks. Good. Thank you.
Okay.
Sorry.
Okay.
Thank you, Lori. I just wanted to say that I have known Lupe for a number of years, and in her position as being head of Youth and Family Center, she has done a remarkable job and is a great conduit for the Hispanic families that are out here in McHenry County. And I want to thank you for all your efforts for applying for this board.
Thank you, Kathy, Kate, for all you do as well.
All right. Well, thank you, Lupe, so much, and it's okay that you don't have a health background.
Well, I saw dentistry, and I'm like, I was gonna say, I did work as a receptionist like for 10 years as a dental receptionist and assistant, but definitely not a dentist.
Yeah. No, it's okay. The Board of Health is very diverse, and there are some statutory requirements for medical professionals. Right now, there's an EMT person and a couple of nurses, and so it's very diverse. And so I think that your knowledge and experience and your involvement in the community will be a great asset. So don't worry about the health degree. You don't need a health degree. So
I appreciate that, though, that you guys.
Yeah, the passion for the community is awesome.
Thank you.
Is awesome. So.
Yeah, I appreciate that. I think boards should be that way, and I mean, with health, again, I mean, looking back, I would be like, there's no way that I would, be, but no, I see all the determinants that go into health and mental health and just health in general, and so I appreciate that you guys have such a diverse board like that. Thank you.
Thank you.
Have a great day.
I was going to come in as a lion, but I didn't think that would be appropriate. Thank you.
Thank you.
Lori?
Yes, Kate.
Yes, I just wanted to ask a question. Does Melissa go out and court maybe, a dentist, an endodontist, there's a number of them that are out here that are new, to the community and relatively new to their practice. So they might be interested in getting that kind of visibility of being, and also knowledge by putting on the board. And I see Peter standing up, so he's got an answer.
And Melissa is here as well, albeit in costume, a very frightful costume
today.
I know that the department has put the word out, but Melissa, if you want to speak to.
Yeah, Kate, I mean, it's a great idea. We have worked through the like the Dental Society, we have worked through word of mouth.
Didn't we do a direct mailing to a whole bunch of dentists?
I thought you guys did.
Yeah, I feel like we have done lots of things, but word of mouth has been a big one. It is hard to recruit a dentist. Actually, the statutes, they can live outside of McHenry County if they practice dentistry in the county. So they don't have to be a county resident. I think it's ideal if it's both, that they practice here and they are a resident. But maybe we could partner with the chamber to push out some information. I mean, if that's a great idea. I haven't tried that yet. I've gone through the Dental Society primarily.
Yeah. Just, sometimes some, phone calls for new ones. I just, had a couple brand new people that were dentists, if they live in the county, might work well. Attendance, that might be a whole, another matter.
Well, if you have names, I'd be happy to reach out to them directly.
Okay, all right, then I will do that.
Super, thank you.
All right. That is out there. I don't know if Mandy's here yet.
Go to 512.
What's that?
Go to 512 while we're reading.
Yes, you read my mind.
All right.
So let's jump to 512, deliberation and selection for the Board of Health. So, as we know, we've got, 3 positions in total, one being the dentist, which we don't have a candidate for right now, and then we have 2 others, one appointment ending June 30 of 2023, and the other ending June 30 of 2025, making sure I'm reading the right things. So, any motion?
I'd like to make a motion
Fabulous.
that we appoint Melissa to the 3-year term and Lupe to the shorter term that she desired.
Okay. And Tracy seconds. All right, any discussion?
That's perfect.
Yeah.
I had just one question.
Sure.
You know, sometimes the positions will like continue. Do people still stay on the board even if that appointment is expired? If like the term is over, do they still kind of stay on until we get a new person?
They have
or?
to reapply. Right? I don't think they've stayed on. I think the term ends and Kathy does a great job of notifying us. So we just have them come back and re-up the term.
Okay, thank you.
All right, I'm really excited that both of these individuals have applied, and I was with them at the Healthy Community Study, and all of a sudden I was like, you 2 need to apply. So I'm very excited that they did. I think they're both going to be a great asset. So
Good job recruiting.
Yeah.
thanks. Well, and Melissa talked with both of them as well, and so we were a couple of us did. So I'm excited. So do we need to vote individually? Well, no, we've got a motion for just one. Do we?
I made a motion for both.
You made a motion. I'm sorry.
One motion for both.
One motion. That's what I meant. One motion for both, and then should we?
And then to clarify, Ms. Katz was for 2025, Ms. Ortiz for 2023.
Yes.
Ms. Von Bergen,
Yes.
Schwartz,
Yes.
Jindrak,
Yes.
Schofield,
Yes.
Meshes,
Yes.
Bates,
Yes.
Parrish.
Yes. All righty. 512 is complete. All right. Let's go back home. Mandy was. All right. Well, why don't we jump to, I think Cathy might be on the phone, so we can circle back around if Mandy arrives. I know she was here on Thursday, so I anticipate that she will be here. Okay, we're gonna move forward and then we can circle back around. Thank you so much.
Okay, we have a call-in user 4.
Okay. Hello. Someone's on the line?
Yes, Kathy is.
Hi, Cathy. It's Lori Parrish.
How are you?
I'm good. How are you doing today?
Much better, thank you.
Excellent, excellent. Thank you for your patience this morning, and thank you for your flexibility in rescheduling with us today. So we've got the committee here, and so we'd like for you to, first we'd like to thank you for applying for the Mental Health Board, and we'd like you to introduce yourself, tell us a little bit about your interest on continuing on the Mental Health Board, as I know you're currently sitting on the board, and your interest for doing so, continuing.
Sure. My name is obviously Kathy Ferguson, but I have, in my professional life, been a family therapist for over 35 years at Northwest Community, which is an inpatient psych unit. I work primarily with adolescents doing family therapy, and I also did psych assessments in the ER. Before that, I worked with the intellectual developmentally delayed for 4 years at a residential school. So my interest in the Mental Health Board is a natural progression of what my life career essentially has been. I have served on the City Council of Crystal Lake for 24 years, in addition to other boards, so I bring a lot of board experience also to this position. My interest is, like I said, a natural progression of my professional career. I have enjoyed working with the agencies and the other board members to improve, continuously improve as part of a team, services to this area. And I think in the 10 years that I have been on the board, a lot has changed. And it is the natural progression for me to want to continue in this role.
Okay, thank you. Any questions from the committee? Go ahead, Teresa.
I'm Teresa Mashis. I represent District 1 on the for the county board. What would you say were some successes or things that you were most proud of with your work on the county on the mental health board?
I'm sorry, I missed half of what you said.
Oh, hi. So I was asking about what are you most proud of from your work on the mental health board?
I think we have brought accountability to the taxpayers. I would say that before it was a matter of how many people the agency served, and now we have, through our quality assurance program, really set goals, and the agencies, I should say, set goals and targets that it's not enough to serve. You have to prove the efficacy of your program, and you have to deliver the services. And we have made that much more objective rather than people feeling like it was subjective.
Okay, thank you. And thank you for your service on the board.
You're welcome.
Any questions? Carolyn?
Hi, Kathy. It's Carolyn Schofield. And I'm just,
Kathy.
hi, how are you? I'm curious what you see going forward. So thank you for, first of all, thank you for your service and your continued interest in looking to see where you feel the mental health board needs to go from here, or any thoughts or suggestions that you may have for it.
I would say that given the social climate and the heightened awareness of mental health issues, that it will be really important for us to be keenly aware of that and keep our mindset in terms of how we deliver services, who we deliver services to. I think the example of the police social work program is a great step forward, given the new police bill and the impact that that bill is having on our police and social services moving forward. It has created many issues that have yet to be resolved, and I would like to be a part of that team moving forward.
Great, thank you.
All right. Any other questions? Kathy, can you speak to how the board itself has changed, or how you see it evolving with new leadership and the direction it's headed?
I think that new leadership, new leadership is always, change is difficult for people. And it doesn't mean that it isn't better or it's worse. It means it's a difference in leadership. That was really very good at building relationships and having people partner and move forward. And at that time, that was exactly what was needed. Leo is a very much a process person, and let's look at how this is working. Let's look at the practicality. Let's look at the cost effectiveness. So I think things have shifted as the needs have shifted. The board, I think, is much different in tone in terms of we are much more diverse as a board, yet we have a good solid basis of people who understand social services and the needs in different areas. So I would say that given the history of who was on the board 10 years ago and who's on the board right now, I think people are much on the board now are much more in tune with the needs and holding people accountable and, you know, looking for ways to deliver the community gaps.
Great, thank you. Any other questions? All right. Thank you, Kathy. I'm not seeing any other questions, so we appreciate your service and thank you for reapplying. We've got multiple interviews this morning, as you're probably aware, so we'll deliberate a little bit later and we'll be in touch.
Okay, thank you very much for your time.
Thank you.
Thank you.
Take care.
Bye-bye.
Bye-bye.
So I have Mandy
Yes.
Jagarnauth,
Jagarnauth. Yeah. Mhm.
and Rachel Boldman
Okay.
in the waiting room.
Okay, we'll, let's circle back to Mandy, and then we'll connect with Rachel, please.
Okay. Mandy, let's join the meeting.
Excellent. Good morning, Mandy.
Good morning, how are you?
Good, how are you?
Good. Sorry, my internet hasn't been working, so I haven't been getting all my emails.
No worries, we certainly know how that happens. Well, we're glad that you could jump on here with the WebEx, and thank you for being here last Thursday. Again, we apologize for needing to reschedule, so I appreciate your flexibility and the opportunity to connect with you this morning. So we've got the committee here, and what we'd like to do is invite you to introduce yourself and share a little bit about your interest and about for being on the mental health board, and then we'll open up the floor to questions from the committee members. How does that sound?
Sounds perfect.
All righty.
My name is Mandy Jagarnauth, and my whole entire life I worked for nonprofits in McHenry County. So I started off at Missouri. I've done Little City as job coaching, and now I am the site manager at GC's Playhouse. And I'm currently in the middle of creating my own nonprofit called Stairway of Prosperity for 18 to 26-year-olds for life skills with young adults. And then I am a mom of twins who are 19 months old. So I'm super busy, but I love it. I don't sit still well. And part of the reason why I want to join the mental health board is the last probably 8 years, I've seen you guys bring the community together, making people collaborate together, and I've seen progress versus the nonprofits kind of competing. And I want to be part of that. I've always worked with individuals with disabilities. I've dabbled in the substance use world just a little bit for about the last 2 years. And then personally, mental health is a big deal for me, and my boys do have developmental delay. So if that's something they don't grow out of or get a diagnosis, I want to make sure that I'm there to advocate for them, and the best place to do it is to be part of a team, do it while they're young, and then kind of, I believe, instead of complaining, be part of don't be part of the problem, sorry. Instead of complaining, be part of the solution. And this is kind of me being part of the solution, is giving back to the community and trying to create the community that I grew up in and just make it better for my children.
All right. Thank you. Thank you for sharing. And again, thank you for applying for this position. Committee members, questions? Teresa?
Sure. I'm Teresa Mashis. I represent District 1 of the county on the board. What How do you think the mental health board could reach out better to like parents in the community to let them know what kind of services the mental health board can offer them?
That's an awesome question. So honestly, getting the organizations more involved to reach out to the families. I was invited to your town hall within 12-hour notice. So I couldn't reach out to my families. I was able to get 2 families to come, and they had no idea you guys held town halls annually. And this is something that she could have got like 10 other families involved. And I know that was one of the things you guys said. It was wonderful to have the organizations here, but you kind of want more family community members too. So I think reaching out to them a little bit earlier and asking them for help to get the community members more involved in getting the information out. The thing that you guys have been doing great the last probably few years since COVID is you guys have been more active on social media, so I definitely see your stuff shared and stuff like that, commented more often than before.
Okay.
Thank you. Thank you for applying.
Any other questions? Go ahead.
Hi, I'm Carolyn Schofield. I represent District 2, and I'm just curious where you see, what you see for the future of the Mental Health Board. Is there any specific area or goal that you would like to achieve if you were to be appointed?
I think my biggest thing is just more outreach. You guys do amazing stuff, but a lot of people still don't know that you exist. Or what you do. They might know the name but not know what you do. So definitely more outreach and getting more community involvement. And that's something that I personally can help them volunteer with. I've been doing it. My work has never done outreach in 14 years, and all of a sudden I was able to do it. And within the 90 days I've been here, I've seen huge strides. So that's definitely something I can help with.
Thanks.
Mandy, have you had an opportunity to attend a mental health board meeting, and what were your, if so, what were your perspectives, or how would you see yourself contributing during the meetings?
I've only attended half of it. My previous job was invited to come to the mental health board meeting to talk about grant funding, and so I don't know everything you guys talk about, but in general, it sounds like you guys talk about a lot of problems and solutions and just what's best for the community as a whole.
And are you aware that for the mental health board, there is at least 2 meetings a month and then 3 to 4 meetings during the allocation season? Is that something that you're aware of, that the number of meetings is more than most boards might meet once a month? Do you have that information?
I was not aware, but assuming it doesn't align with my work board meeting, I should be able to attend without a problem.
Okay, all right.
Oh, another question.
Sure, go ahead.
Thank you for another question. So it's Teresa Mashis again. Are you familiar with the budget of the mental health board and how the allocation process works?
Not the allocation process. I have read over your budget in the past. To be completely honest, I don't remember at this time. But I have gone over your public records and that kind of stuff. I think it was probably last year. I was researching some stuff. I know you guys vote on a lot of stuff of where you guys get federal grants and fundraising and stuff like that, and you vote what organization or where it's going in the community. But besides that, I know I'm probably missing stuff.
All right, thank you.
Well, thank you. There's always lots to learn. Always lots to learn on a board. Alrighty, any other questions? Okay. Seeing none, Mandy, I want to thank you again for applying. We appreciate your interest and again, your flexibility. And we've got several interviews this morning, so we'll be deliberating a little later on, and then someone will be in touch either way.
Okay, Sounds good. Have a great rest of your day.
Thanks, you too. Happy
Thank
Halloween.
you.
Thank you.
Yeah, you too. Bye.
Okay. All right,
Ready for Rachel?
certainly.
Okay.
All right. Good morning, Rachel. Oh, there she is. Good morning, Rachel. It's Lori Parrish. Thank you for being here this morning. Can you hear me okay? Oh. Okay. All right. So we've seen your application, so thank you very much for that. And I'd like to invite you to tell the committee a little bit about yourself and then your interest in reapplying for to be on the mental health board. And we'll go from there and open it up to the committee for questions.
Great. Yeah, thank you so much for being flexible with all the things that I have going on campus. So that kind of leads to the first thing about me. My name is Rachel Boldman. I work at MCC. I'm the Director of Student Engagement and Support. And what I do at MCC under that kind of title is that I oversee student life and student diversity and inclusion, as well as all of the student support programs that we have, the many student support programs that we have at the college. So I oversee our Student Success Fund. I oversee our mental health service provision. I'm also a licensed counselor. I don't provide ongoing counseling to students, but I do provide the crisis intervention and one-time stabilization counseling that many of our students need. I also am the Title IX coordinator at MCC. I oversee any situations involving sexual harassment or any other type of bias or harassment based on protected class. I also oversee our community partnerships with local counseling centers, the food pantry, McHenry County Transportation. All of those sorts of things are kind of under my purview. I've been on the mental health board. This is my first term. I was lucky enough to be appointed to a 4-year term last time around. I can't believe 4 years has gone by. It seems like yesterday and 4 years ago all at once that I first started on the mental health board. But I am really interested in giving it another go. I think it takes a little while to really learn how a board operates and to really function at the highest level in the board. So I feel like in many ways I'm just getting my feet wet with my first term. So yeah, I think that's a little bit about me. Would love to know what other questions I can answer.
Okay, great. Thanks. Questions from the committee? Go ahead.
What work on the board have you done that you are most proud of?
One of the things that I'm most proud of that the board has kind of, I guess, accomplished in the last several years. I came in at the tail end of the agreement with the homeless shelter at the chapel in McHenry and sharing that space. So that was really cool to kind of see the end of that come to fruition and then see it launch. So I wasn't necessarily a part of decision making for that, but I remember a really tough situation with the one of our funded agencies or organizations, the Epilepsy Foundation. And I'm really proud of how the board navigated the difficulty around that situation. There were a lot of questions from the community and a lot of really difficult feelings from the community. And I feel like the board and the executive director really took the time to listen to the concerns. And it didn't necessarily change the outcome for us, but we were able, I think, to alleviate some of the fears within the community and then also help point people towards alternate solutions and alternate services.
All right. Any other questions? Go ahead, Carolyn.
Hi, Rachel. I'm Carolyn Schofield. I represent the current District 2. And I'm curious if you have any goals for the future, where you see the future of the mental health board, or how, if you were to be appointed or reappointed, the progression of the board, or where it would be headed.
Sure. I think we're in a really interesting spot right now with just having hired a new executive director who's been in the role now less than a year. So I think one of the main goals is for the board to continue getting to know her and for her to continue getting to know the board. And part of that is on us, the board, openly communicating with the executive director. So one of my goals would be to make it a point to develop a stronger relationship with her. I think we work best together when we know a little bit more about each other. And over the past few years, I've actually been getting my doctorate, and I think that's hindered some of my involvement in the board, or some of my ability to really go deep with my involvement in the board. And so now that that's over, thank goodness, I feel like I do have the time to maybe make some more personal connections, specifically with our new executive director. But as I think more on like the business side, we're going to be making some difficult decisions in the next couple of years about our funding and who we're funding. And so I always want to be, and it would always be my goal to be someone who can speak to kind of the clinical side of what we're doing on the board, or what our agencies, our applicants are doing, and then also to like the administrative side, because that's very much where what my role is, a little bit of the clinical side and then a lot actually of the administrative side. And so my goal would just be to provide that clinical and administrative voice. I think I've done a good job of that so far, and I would want to continue.
Thank you, and thank you for your continued interest. I have one follow-up question on that too, since the challenge, I mean, right now, the funding side is really the challenge for everybody. So just wondering if you have any specific thoughts in relation to the mental health board as to how you can balance that, with the increase in the need of services and really that outreach in our communities, and yet having that financial limitation.
Yeah, I think we need to continue to listen to the community and really support what the community feels is most important. And I mean that on an actual, like actually listening when they talk to us, but then also the trends in utilization. Which organizations, which agencies are utilizing the most funds and for what? I'm the chair of the Ethics and Compliance Committee, and so I am able to see some of the compliance records and some of the audits, so I have a little bit of an inside view into who's doing what. And certainly that's not only information that I can access. The whole board could ask our compliance person, Terry, for further details as needed. And so, yeah, I think really paying close attention to what are the needs in the community that will guide us to the funding, how we balance funding. I'm really interested to see what new agencies are ready to come forward and apply next year. We had a couple of new agencies this year, but I'm always interested in who are the new folks who are doing innovative things and how we can help them out. And even if it's just giving them some seed funding for the first year, I'm all about innovation and new programs with the community, but we won't know what the community needs unless we listen. And I do think we do a good job with that. I want to make that clear.
Great, thank you.
Yeah.
Any other questions? Okay, Rachel, I'm not seeing any other questions from committee members, so thank you so much again for your flexibility and for reapplying and for your service thus far. And we've got a few more interviews, and we'll deliberate, and then someone will be in contact with you.
Great, thank you so much.
Thank you.
Have a great day. Is Lindsay in the waiting room?
Yes.
Okay. All right, good morning, Lindsay.
Hello.
Hello. I'm Lori Parrish. I'm the chair of the PHCS committee. I need to slow down. Thank you for being here this morning. We appreciate your flexibility in regards to needing to reschedule your interview. And so what I'd like to do, all the committee members have seen your application. And so that's where we've been able to start to educate ourselves and learn a little bit more about you. But if you could share with the committee members who you are and share your interest in applying for a position on the mental health board, please. And then we'll open it up for questions.
Okay, sounds great. Thank you again for letting me do a WebEx. I'm sorry I had some other commitments I need to keep, but I am Lindsay Keisman, and I am the director and owner of Pivotal Counseling Center. I also run a consulting business. I'm kind of a national platform with myself, helping other people start and grow their own medical and group-based practices in the healthcare arena. So why do I want to join the mental health board? I have applied in the past, and I am a born and raised Woodstock person. And one of the neat things about coming back to McHenry County after going off to graduate school and living in Cook County was learning that there was such a thing as a mental health board. So it's kind of an amazing thing to have access to those types of resources. And when I started my job at Centegra, we were the recipients of some of those dollars that really helped a lot of people in the community. So I've always been inspired by that, and I've been in and around a lot of people that are funded by the Mental Health Board. I sit on the McHenry County Substance Abuse Coalition board, and really have just appreciated getting to see, you know, what we're able to do for our community, and I want to be a part of that. I want to be a part of helping the board, and I feel like I bring kind of that balance of background in behavioral health, but to be honest with you, I've turned myself more into a businesswoman than I have necessarily a therapist these days, and I think that's a kind of a neat combination that I hope would be useful. Yeah, so that's my brief introduction. I guess I'll stop there.
Okay, great. Thank you for sharing that. I'll invite committee members to ask a question or two. Go ahead, Teresa.
Hi, I'm Teresa Mashis. I represent District 1 of the county. Thank you for applying, and thank you for your work on the Substance Abuse Coalition, which I also try to attend. Are you familiar with the budget of the Mental Health Board, and how do you see the allocation process, and like what priorities should be? What priorities should the Mental Health Board have in their allocation process?
Sure. So I understand that there's some fluctuation year to year, but I know it's around 10 million, between 10 and 11, I believe. And as far as the allocation, you know, my understanding is that really we're trying to hit everything in behavioral health care, so, you know, mental health, substance use, and, you know, developmental disorders, intellectual disabilities, so kind of servicing, you know, the entire community from children to the elderly. And as far as allocations, for me personally, I think that for people who have been active in the mental health board and receive funding, it's always a balance of how have those programs been running and what outcomes do they have. So making sure that, you know, current programs that are funded, you know, remain funded as long as they're sort of meeting the brief. And also that if there are new and developing programs, that they are truly servicing a gap in our community. I never want dollars to be spent on a redundancy, so that would be something for me that's important. But
equally amongst those communities of mental health, substance use, and intellectual disabilities is how I would see that funding being allocated.
All right, thank you.
Thank you, Lindsay.
Hi, Lindsay. I'm Carolyn Schofield. I represent District 2. And thank you for reapplying and not getting discouraged. I really appreciate the passion that you have for that. So that's awesome. And I'm curious what your goals for the future of the Mental Health Board, if you have any, as far as where you see it going, or if you have any personal goals or contributions that you would like to bring to the board.
Yeah, sure. So I think that as far as where I'd like to see it going, I can speak a little bit to not the current executive director of the Mental Health Board, but the previous, executive director, Scott Black. He had sort of a mission and vision for incorporating what I would sort of call the community mental health providers and behavioral health providers with the private providers. I think the Mental Health Board, as a private, business owner, is not something I ever think about, right? I do, just because I've been, in this field for a bit and have worked for some agencies that have interacted with it. But the Mental Health Board really does quite a lot for our community, and I think that there's sort of a divide between, maybe I'll call it the bigger community agencies like the Rosecrances or the Aunt Marthas, all the way to the little guys who, quite honestly, we all kind of work in the same system. So that would be one thing I would love to, keep in the forefront of how we can continue to kind of bring our community together to service, the whole person who may start their services in one place but then transcend into another place. So that kind of continuum of care is something I think would be a really neat thing to continue. And I'm not sure, I just haven't had as much opportunity to get to know the new executive director. She hasn't been around as long. So that may still be something that the board is hoping to focus on, or that she has some mission or drive towards, and I'd love to be able to help support that. Yeah, so I hope that answers your question. And then as far as what I bring to the board, I have a history of being on board, so I think that I really know how that works, how to support something and ask good questions and be data-driven, and also, stand for what is right. And sometimes that means making hard decisions. I know that usually the Mental Health Board gets more requests for funding than it has dollars to say yes to. So that is a process where you're picking between things. You probably want to say yes to all of them. So just being really good and discerning. Like I said, as a businesswoman, I have to make hard decisions that are based on numbers and dollars and productivity and data, and it's not something I'm afraid to do if needed. So yeah.
Great, thank you, and thank you for recognizing the asset that the Mental Health Board is to the community, because I think sometimes people from other counties don't realize that it's it's kind of a rare gem that we have here. So I appreciate that.
Yeah, it really is. I don't think people know how grateful we should all be for it, because working in different counties, it's much harder as a care provider to give people the care that they need. And when I moved to McHenry County, I remember being like a deer in headlights, kind of like, wait, what? There's all these places and you can go and the county just helps fund that? That's crazy, right? So yeah, it's really a fantastic thing.
Great, thank you.
All right. Thank you, Lindsay. Any other questions from committee members? Nope. All right, that concludes your interview, so thank you so much for being here, and we've got a few more interviews, so we'll deliberate a little bit later this morning, and someone will be in contact with you.
Okay, thank you so much. It was nice to meet you all virtually. I hope you guys have a good rest of your day.
Thanks, you too.
Take care, bye.
Bye-bye. Good morning. Christina? Hi. Hi. I'm Lori Parrish, I'm the chair of the committee. Thank you so much for being here today. Appreciate your flexibility. We had to reschedule from Thursday, so what we'd like to do is, we do have your application, we've seen that, so thank you very much for completing that in its entirety. And if you could tell us a little bit about yourself and then your interest and reasons for wanting to participate in the Mental Health Board, and then we'll open it up to committee members for questions.
Okay,
All
great,
right.
thank you. Thanks for inviting me to meet with you today. It's a great opportunity for me to learn more about the board and its activities. So I go by Chris Bruhn, and I'm currently an associate professor at the School of Social Work at Aurora University. And the relevance of that to McHenry County is that we have a location in Woodstock, actually at the former Challenger Center. We ended up buying the building and turned it into a 4-year college completion opportunity and some graduate programming for students. One of our programs is social work. So I'm a social worker by training and have primarily in my social work life been involved in mental health services to people with intellectual disabilities, worked in, a suicide hotline, halfway house for people with chronic mental illness, worked for DCFS as a placement worker, anti-family services worker, placement stabilization, SAS, which is hospitalization deflection, worked as a private psychotherapist for mostly kids in foster care and adoptive settings, but also deaf and hard of hearing populations. My husband and son are both deaf, and we use sign language in our home. And the other aspect of my kind of career development has been as a program evaluator. So I worked for, about 9 years as a subcontractor for the Department of Children and Family Services, doing research at a policy level for DCFS to give them guidance about policy decision making, and I continue to work as a program evaluator as I work as a faculty member at the university. So right now we're doing an evaluation of the Family First Preservation Services Act, which is a national act to promote intact family services. So we're evaluating the nurture and parenting program, child parent psychotherapy, have evaluated a number of other big policy initiatives, things of that nature. And I'm doing some after-school program evaluation for 10 after-school programs in the city of Aurora. Several other smaller projects. We're doing some evaluation of a LEAD program, which is a pre-arrest diversion program for people who've committed kind of low-level crimes, to try to provide them with case management services as opposed to arrest and incarceration. Mm-hmm. So we're evaluating the cost effectiveness of that approach. So I've been very fortunate, I think, in my career to have a very wide range of different experiences, and I think my hope, if I were to be able to serve on this board, would be to kind of bring, the range of experiences that I've had to, the discussions and deliberations that come before the board.
Okay. All right. Have you had an opportunity to attend any of the meetings?
No, not yet.
Not yet. Okay. All right. And are you aware that while many boards meet once a month, with the Mental Health Board, there may be some months where there's 2 meetings a month, and then during the allocation season, there might be 3 to 4.
Yeah, I looked on the website to try to figure out when the meetings were and if I could make the meetings, and it looked like there were meetings on Tuesdays, but there were other bigger meetings at other times, so I had a sense that there was more than one kind of meeting.
Okay, great. All right. Committee members, any questions? Teresa.
So I think your experience with program evaluation and the breadth of experience you've had in the field really would be an asset to the board. Do you see? I was trying to also figure out. Are you you have lots of roles. So are you do you subcontract yourself out for your services, or?
Yeah, it's actually, that's a good question.
Yes.
So the teaching is through the university.
Right.
And then some of the evaluation work that I do, the after school programs, also goes through the university.
Oh, okay.
We're kind of like a community, a private public partner.
Okay.
And so we have a partnership with the local school districts, and we do their evaluation for them. They pay the university, and I just do the work. But most of the people that work at the university are also encouraged to stay active in the field and do something outside of just teaching, so that we have something real to bring back to students. So some of the subcontracting that I do, the DCFS evaluations, that's a private you know, kind of enterprise separately from the university. So it is kind of, you know,
Okay.
there's more than one thing going.
Okay. And so do you would have the flexibility for these different scheduling meetings? You would have flexibility, okay.
Actually, university work that's the one benefit is, you know, if you're teaching, you kind of have to show up.
Right, yes.
And there are, you know, periodic meetings, but otherwise I kind of manage my workload in a way that is feasible for me. So it gives me some flexibility to be able to do that kind of thing.
Should I take more questions or should I come back around like I'm just going to lead the meeting over here? I will back off and let my colleagues ask questions.
All right, but hold on to them. Maybe we'll have time to back around.
Right, yes.
Carolyn? Hi, I'm Carolyn Schofield. I represent District 2. Thank you for applying and for the extensive background that you have. Curious if you've given any thought to the future of the mental health board and the goals that there may be going forward, or what you could contribute to it.
Yeah, you know, I mean, we think about, in social work, you think about those kinds of things all the time because, you know, social services that we provide are so dependent upon public resources and really on the economy and on tax revenues and government policy and so many different, you know, kind of dynamics that play into the resources that feed into social services. And so it's just so dependent on like public understanding about what we're doing and their support of it and just kind of mental health destigmatization altogether. And so I see it as like kind of a big picture thing where, you know, trying to promote, you know, public goodwill is of value. And, you know, from my program evaluation lens, I think being able to demonstrate the impact of the programs that are out there on people experiencing the services is really valuable. Like I know Scott Block, I know he had some affiliation previously. And, you know, he teaches at Aurora University too, so as an adjunct professor. And, you know, talk to him about how do you know, collect information about the impact of the services and how do you utilize that to strengthen the services and also to communicate with the public about, you know, what are we doing? How are we helping people? And so when I think about like future directions, I think, you know, not necessarily, you know, having like a, you know, a program plan in mind, but just thinking about public priorities, those are some of the things that come to my mind.
Great, thank you.
Teresa, did you have anything? No?
Well, so, I mean, I think you talked about the priorities you have on the board.
That's great. If you don't, if you just wanted to.
Right, so go past me, thank you,
Right.
thank you.
Any other questions? Tanya?
Thank you. One of the items that you mentioned that we should, you know, really be considering as far as a challenge is concerned is the workforce shortages in the social services industry. And you mentioned, you know, maybe providing some unique approaches on how you could maybe close that gap, and just wondering what kind of, you know, innovative ways you were thinking about, like how we can fill in those shortages, those workforce shortages.
Yeah.
Big one, right?
Yeah, so, you know, because I work with, we have basically, so Aurora has 1,000 social work students. And, you know, recognize that they, you know, many of them are thinking about clinical social work and wanting to do that. And we're also observing like kind of a shift of the clinically prepared workforce from, you know, like agency-based work to private psychotherapy. And I think that the pandemic played a role in this because there was so much more, I mean, honestly, it spurred mental health needs. And there was also more communication about mental health needs and a degree of destigmatization in my perspective, which has led people to be more willing to seek out services and mental health parity, which allows, you know, insurance companies to bill for mental health services the way they do for physical health services has allowed some degree of access. Many of the practitioners that I know have shifted away from agency-based workforce to private workforce, which I think is one of the factors driving, you know, under availability of staff in agency-based settings. And so I'm like, well, how do you kind of turn that around? And, you know, and so one of the things I think about is how can you provide like professional development opportunities to people in agencies that makes that attractive for them in terms of like becoming a more skilled, experienced practitioner. And, you know, I think about like how, you know, how can you partner with higher education and other resources to try to give, people working agencies something that's going to make it, more, worth their while. But I also serve on the Illinois Children's Mental Health Partnership, which is probably going to stop after a while because they just changed like the role legislation about who's on the partnership. And so, I've been there long enough. I'm probably going to shift out and let other people, fill those roles. But they talk all the time about, children's mental health and how one of the big challenges, particularly in rural settings, is just a lack of qualified practitioners. So, trying to make that workforce development opportunity available and thinking about leveraging resources like online education and telehealth, I think is important and, it's probably going to need ongoing attention.
Wonderful. Thank you.
All right. Well, I think that concludes your interview for this morning. So thank you again. I appreciate you being here and your interest in the Mental Health Board. And we'll finish up the rest of the interviews, and then someone will be in contact with you.
Fantastic.
Thank you. Thank you so much, Chris. Okay, I thought I saw Scott out there with someone, but I don't see him now in the window. Good morning, Amy.
Hi, good morning.
Thank you for being here.
Yes,
I'm Lori Parrish, Chair of the committee this morning, and want to thank you for being here to interview for the Mental Health Board. Appreciate your flexibility in rescheduling from last week to today.
Sure.
We do have your application, so thank you very much for completing that in its entirety. What we'd like to do is invite you to share a little bit with the committee about who you are and your interest for participating in the Mental Health Board, and then we'll open it up to the committee members for questions.
Okay, great. And there's folks on the Zoom as well? I don't want to.
There is, yes, Ms.
Okay.
Bates.
I don't want to ignore
is,
people. Okay,
sure.
Great. So, hi everyone. Thank you so much for having me. I really appreciate the opportunity. So my name is Amy Rath, and the reason I was interested is because sure, I don't have to tell anyone, but mental health is obviously an incredibly important topic, and it's very important to me personally as well. So a little bit about myself. I grew up in a home where one of my parents struggled with, I'm gonna get emotional, struggled with an addiction. So I understand from sort of the general perspective how that affects the entire family. As I've gotten older, I've understood more about how it affects the parent and the individual. But certainly from a child's perspective, it was something pretty incredible to struggle with. I'm the oldest of 4 sisters. One of my sisters, in part due to our parents' situation, has a severe eating disorder. Thankfully, she's doing much better today. But it is a lifelong challenge. Like, it's not something where you're ever fully cured, and you really do need that ongoing support. And support from the community and those around you can be particularly helpful. Which is where things such as community education and resources can help as well. As folks might be aware, any sort of mental health challenges are currently quite stigmatized in our society, which makes it even more challenging and difficult to find resources. I can hear my voice shaking. Sorry about that. Really important topic to me. So it's been important, something I've been passionate about for my entire life. This past year in particular, it's come into much sharper focus and become a key topic for me and my family. My oldest is in high school. We moved here from Lake County in 2020, so at the height of the pandemic, we moved here. So that was difficult for her, but she experienced very significant challenges earlier this year. I'm gonna protect her privacy and not say exactly what they were, but it was traumatic. Thankfully, she is also doing much better with a lot of support. I think there were several factors that went into it. I've learned a lot about the extent that our youth are really struggling. I think the impact of COVID and other factors has had more of an impact than many people are aware of. I think even you can be in the thick of it and not quite realize how big of an impact it is. And finally, my two youngest, so my oldest is my biological daughter. My two youngest we adopted from foster care when we were foster parents in Lake County. We are not currently. After we adopted our youngest, we said we need to just focus on our own family right now, but it is something, again, in the future we would like to do, and we feel like, you know, our kids are a little bit older. So they are both adopted out of foster care. We've fostered more than two, but those are the two that we've adopted. They have their own struggles. They're quite young, and thankfully are just absolutely lovely kids. But I've seen in working with my oldest daughter the struggle when you have private insurance. But when you have public insurance and state aid, like my two youngest do, it is an entirely different ballgame. Unfortunately, often those are the most vulnerable members of our community, folks that need that public assistance or that are on Medicaid or Medicare. And I am a very persistent person. I think of myself as very resourceful. I can't imagine what it's like for somebody that doesn't have the stubbornness that I have. When you have hit a point where you are reaching out, where you have needs, where you are trying to get help, and just trying to navigate that system. First of all, if the resources are there, and thankfully McHenry County does have them, they can be quite difficult to find, especially for any one particular set of circumstances. So finding mental health care for youth, very different than trying to find mental health care for other situations. Not that I'm saying those are necessarily less challenging. So as an individual, as a parent, as a member of the community, I am not a mental health professional, likely never will be, but want to do everything that I can to help. And when I saw that this was an opportunity, I said I would absolutely love to do anything that I can to try to give back and hopefully make the world a little bit of a better place for others. So, thank you.
Thank you for sharing.
Mm-hmm.
Have you had a chance to attend any of the mental health board meetings?
Unfortunately, I have not. No, I was reading through different minutes, but I have not attended them. That is something that I do intend to start doing. It was a little difficult for me to see when it was open to the public and when it wasn't, so I wasn't sure if I was assumed it was always open, which is part of the reason I was reading minutes, but yes.
Super, thank you. And then in your research that you were doing, many boards will meet just once a month, but the mental health board frequently meets twice a month, and then during allocation season it meets 3 to 4 times. Is that something that you're aware of, and is that something that you'd be able to
I saw that
incorporate?
definitely. I saw that it was a varying schedule, and I saw that there were times where there were more frequent meetings that, absolutely, you do what you have to do. Yep, definitely.
Okay. All right, committee members, I know there's some questions, or anticipate some questions from our committee members, so anyone?
I feel like I should let you go first this time. I'm always dominating here.
Hi, I'm Carolyn Schofield. I represent District 2, which I'm currently a representative, actually. And I am just curious if you've given any thought to the future of the mental health board and where you would like it to go, or any goals you would have, or you see additions to the board, or the path it's going on, or how you kind of see the future of the board.
No, thank you so much for that question. That's a great question. So I do have some thoughts, and I will try to keep them concise. I think one, you asked about goals, so thank you for asking about that. I think that one of the general goals a couple of them should be better communication of the resources available, because there are some very, very good resources, but they are unfortunately hard to find. And I think unless you're looking for them, you might not appreciate just how difficult it is to get started. There's a lot of free resources. There's different places that you can start where it's actually really easy to get started once you know the path that you are supposed to be on. But finding that, unfortunately for my oldest, it took kind of a significant tragedy for us to kind of get on that route, which I think we could have avoided if we just hadn't spent so much time kind of stumbling in the dark. So I think communication of resources. I think making the resources a little bit more up to date, because we found a lot of things where I'm sure everyone is very busy doing the best they can out of nobody's fault or any ill intention. It's just not clear. And I think about folks that are struggling in a time of need, looking for something to call 1, 2, 3 places and find out, no, we can't meet exactly what you're looking for, and might not be able to offer a recommendation. I think if there is a better consolidated resource, or even just time spent in helping to keep some of the resources more up to date, which I know takes precious hours away from other things, but ultimately we serve the community. And so I think having that lens of what can we do in order to make sure that we are thinking from that perspective. I think one final, I've talked for a while, I'm sorry, but I see the liaison with the intake coordinators. I think that is fantastic. I would love to, and I don't know quite exactly the details of how that works, but understand more from them. What are you seeing from people coming in? How difficult was it for folks to find resources? And that's a partnership that I would love to continue to explore further, because I think getting that additional insight is something that could be really crucial in helping the board execute more on the goals of serving the community. Thank you.
Thank you.
Yes.
Thank you. Kay, did you have something?
No, but I will tell you, I did very much you become impressed with what you stated, Amy, regarding the hard to find the resources. You know, to sometimes when you are in a particular field, you don't always review this and find out, you know, is it really getting to be out there to the public, to Mr. and Mrs. John Smith, and, you know, having difficulty, and that, of course, concerns me, and I appreciate you bringing it up.
Thank you. Teresa, did you?
I'm Teresa Mashis from District 1. Thank you for applying and sharing with us all of your experience with your family and to the community. Are you familiar with like the budget of the mental health board, and what do you see are ways that you can help meet their mission?
It's a great question. So I did review the budget. There's a lot. Like I saw where different, you know, where all the different allocations are. I work and have spent most of my life working for small private organizations, so very familiar with trying to be creative resources, help to extend resources, being accountable for, you know, the limited resources that you might have. So I didn't come prepared to say, cut this or expand that, although I did look it over, but really feel like having that, I mean, almost 20 years of experience in trying to make sure that we can creatively do what we need to do with limited, you know, sometimes limited funding and allocation, is something that I think I could help apply. Also, and I don't know how often the board necessarily thinks through this lens, so if what I say doesn't make sense, please ask me to explain it. But in working for small organizations, you often have to figure out how to tell the story of the value that you are providing. I saw the excellent video on the McHenry County Mental Health Board's website, which was a great explanation. I watched it multiple times in order to make sure that I was getting, you know, the understanding of it. I think there's further that can be done to tell that story, and I think that also helps with things like fundraising, you know, or stuff like that, getting information, getting more resources in order to help the community, having that concise way to say, here's what we do, like here's the value that we bring, and here's how it's better for everyone around us. So those are additional skills that I would like to take a look at and see if there's places where I can help there. Is trying to not only manage the funding that we have, but hopefully acquire more of it or secure more of it, and that ability to explain this is exactly what we're bringing to the community. Thank you for that question. Yeah.
Thank you.
Any other questions? Okay. All right. Well, thank you very much, Amy, for your time this morning and for sharing some very personal things. We appreciate that. And we have a few more interviews this morning, so we'll deliberate, and someone will be in contact with you either way.
Okay.
Thank you so much for your interest.
Thank you so much, everyone.
Paula here. Is Paula here?
Dr. Yensen is here.
Dr. Yensen, yes. We'll do one and then the other. And then we'll take a bio break for anyone who needs it.
Yes.
Good morning, Dr. Yensen. Thank you for being here today.
Yeah.
Come on up. You know the drill.
We don't bite. Where would you like me at? Right
This
there.
is
Right there,
where
there's a mic,
this
so
here,
the
yes.
estates can hear you.
Yes.
Don't be shy. Don't be shy on us now today,
Don't be
Dr.
shy. Okay.
Yeah, Dr.
All right,
Yensen,
all
don't
right.
be shy. All right, well, you know all of us, so you're on the different side of the table today, but welcome. Thank you for being here. So what I'd like to do is focus on the mental health board position first. That's in our agenda is that. And then we'll shift to the senior services grant. So tell us a little bit about your interest in applying for the mental health board in this capacity. And then the committee will, I'm sure, have questions for you.
I'm sure they will, and I want to thank everyone for the opportunity to be here with you. I want to, I've had a lot of time to really think about this, but I want to get back to the community after I'm done serving on the county board. And I'm very passionate about the mental health board and the services that we provide. I think we're the second largest mental health board in the state. And I'm very proud of the fact of the continuum of services that we provide and the thoughtful consideration that we have at the mental health board as far as the gaps in services. And I want to continue that conversation serving on the mental health board about the gaps of services so that we can serve more people in our community. And I probably overthought this, so forgive me. Some of the gaps in services that I see occurring are the psychiatric opportunities for individuals and families. And we need to increase autism services. And this is really important. We lack substance abuse residential rehab facility in McHenry County. We're sending people outside of McHenry County, and we all know for recovery, we need to have family and that family system to help them with their recovery. And the other part is the rehab stabilization residential facilities and programs for children. And that's another gap. And then finally is to discuss, and I hope the mental health board, if I'm selected, would have a conversation about mental health services in long-term care facilities. As people age and they have developmental disabilities, they are placed in long-term care facilities, and there are not many services provided for mental health. And then the other part is we're in the process of the 988 rollout and 590 program. And Rosecrans is going to be taking a leadership role with this. And it's a 4-tier service with level 1 and high risk, which a person is acting out their plan, like suicide ideation. Level 2 clients have suicide ideation, and the call is forward to the 590 provider with a 2-person team is sent to respond and handle the RAP service. And level 3 is receiving the call, and level 4 receives the call, which requires an intervention. So some of those are some of the kind of ideas and thought processes that I have in wanting to continue that conversation serving on the mental health board.
Okay, thank you. All right, questions from the committee? Go ahead, Teresa.
So how do you, I'm laughing because I almost always start the questions, but really, how would you see your role changing from being the liaison that you've been for the last 8 years to being on the board as a board member if you were so chosen?
Well, I want you to know that my colleagues on the mental health board have really been very accepting of my presence. So the only difference is that I will not be coming to the county board meetings and giving you the reports on a monthly basis. I will continue to advocate on behalf of the people that we serve at the Mental Health Board. And I do believe that I have a very positive relationship with my colleagues. I have only, I have been a liaison and tried to create a bridge between the county and with the Mental Health Board. And I'm not going to be a part of that bridge when I serve, if I'm appointed.
Yes, you will. You'll just be on the other side of it.
I mean, I have found those liaison reports very helpful. So thank you for the liaison reports for the last 2 years.
Well, you know, I think the other strength that I bring to the table is that I understand board governance. I understand how government works, and that conversation is very important with my colleagues and the executive director, Leo, and Connie, giving them feedback about what is the proper way to move forward in advocating for our issues. So I hope that answers your question.
Any other questions?
I have one. Thanks for bringing all of these ideas. I mean, it was very detailed. But along with that, obviously, goes the financial piece of it. So I'm wondering if you've given any consideration from a budgeting standpoint of how to execute the vision that you have.
I think we need to have a conversation in the future about the levy and how we go about increasing that levy for the Mental Health Board. And also consider other kinds of funding streams for grant-making opportunities at the Mental Health Board that would help agencies. You know, the opioid thing has been a discussion, and where that conversation has changed as far as the amount of money that we'll be able to allocate. And I think we need to diversify some of our funding base beyond the levy.
Any other questions for Dr. Yensen regarding the Mental Health Board? All right. Well, thank you for that. Now everybody will take a breath, and we'll shift to Senior Services Grant Commission. So again, why don't you tell us a little bit about your thoughts on applying for this and your ideas for the future if appointed.
Well, as you know, I was chairing the Senior Services Grant Commission, and there was an opening for at-large, and I decided to apply because I think my skill set and my knowledge base would be of benefit. I think the Senior Services Grant Commission is going to be going through some major transitions because there will be fewer board members, and there's going to be a revisit of the bylaws. And the question is, and I don't expect anybody to answer this, but what is that configuration going to be? Is it going to be purely appointed from the community to serve on the Senior Services Grant Commission? And is there going to be a liaison from the county board to serve specifically on the Senior Services Grant Commission? I have no vested perspective about it, but I think those are important questions to consider. Secondly, I serve on Age Guide Board of Directors, and I'm the vice chair of the treasurer as treasurer. We oversee $30 million, and we have $2.6 million in administrative costs, which is a good ratio. But my point is, we see an expanding population of people that are older adults in McHenry County. And so how do we do more with less? Because the levy here has predominantly stayed flat. And Age Guide probably allocates equal amount, 1.6 million. So how do we continue that conversation so that services are being served and met to the older adults? And I believe, based on my professional background and my volunteer background, it would be a benefit to serve on the Senior Services Grant Commission, understanding the big picture.
Okay. Thank you. Any questions from the committee?
How do you see your role changing? So you couldn't be the chair anymore of the Senior Services Grant Commission. Do you think that you would have a hard time adjusting to kind of the change in leadership?
No, because many of you know Mary Reed. It's been a partnership, and in my leadership role, I've always been a facilitator and listening to everybody at the table and value everyone's opinions and decision making. And I would be happy to be a part of that board due to the fact there's less responsibility and I can just set up. Do you know what I mean?
Yeah, Adjournment, yes, yeah.
And ask questions about, not that I always ask questions, right. But it is more of a facilitative conversation with everyone there. So I would not have any trouble in being a part of the board.
Mm-hmm. I mean, certainly you've done a lot of work. This is certainly something that you're very a lot of experience. Thank you for your continued service.
I have a question. I just kind of have a statement. I really appreciate you applying for this. What you bring to the table is incredible, and we're lucky to have you.
Thank you.
Reapplying.
Yes. But you know, my sister-in-law came. She's from Dayton, Ohio, and I used to work in Ohio in long-term care. And the experience working at Family Service in Butler County, where we provided in-home services to the seniors, helped me provide a better understanding about the community care program, respite care services, dining and everything. And in Butler County, there's this place called Otterbein, and it's similar to Valley High. Only they have a radio station for older adults, and they have assisted living. They have the broad continuum of services on the campus. And we were part of the music therapy for Alzheimer's, where I worked, and that was the cutting edge from Miami University, which is the Gerontology Center research area of Ohio. It helped me ask questions if there's a better way to serve seniors, and is it good science in the development of those programs. You know, and I think that's something we all need to ask ourselves. That's my story.
I have one more question too. So on the Senior Services Grant Commission, we've kind of gone through this. Where does it go from here, or what should the future of the commission look like? I mean, do you have any thoughts? Are you fine with the current configuration, or did you have any thoughts of what might be, more efficient or effective, or any changes that would be necessary?
You know, Carolyn, this is my thought. We're going to have fewer county board members, And in the past, there was discussion about people not realizing when they signed up or was assigned public health and community services that they were also going to be assigned for the Senior Services Grant Commission. So some people believe that should we be doing that? Should those people be assigned to do the grant commission if they serve on public health and community services? And how much time do county board members have in their committee assignments and still invest on the Senior Services Grant Commission? And that is the question that we all have to ask. Do we appoint? Do we review the bylaws, and do we appoint people from the community to serve? And I talked to Chairman Bueller a little bit about it. It's, I think it's up to all of us to sit down and really talk about it. I don't have one view or another. I believe the Senior Services Grant Commission throughout time has worked. And we come together and we work hard and we make decisions that are that are fiscally responsible, and we do our due diligence. I think everyone does, from the committee to the county board members that serve. So that works, but I think you may need to revisit what that model is going to be. But I want to be at the table so I can talk about it.
Yeah, thanks for continuing. You think you want to breathe or something, but yeah, let's do a house project.
It's going to be complicated in the future.
Well, Dr. Yensen, I have one quick question. We have, as you know, there are several individuals that applied for the mental health board, and so you've been on this side of the table when we've got some difficult decisions to make, because we only have a small number of seats for the number of people who have applied. So I'm curious that when we go to make the decisions for the mental health board, given your involvement in Age Guide and likely involvement in the Senior Services Grant Commission, if you were not recommended for appointment, specific appointment to the mental health board, how might you see yourself continue to be involved in the mental health arena and the efforts of the mental health board?
Quite frankly, I don't know. I don't know if anyone would want me in the community, but seriously, I want to serve in both capacities. I'll be very frank with you about it.
Yeah.
And I believe what I offer to the mental health board is very unique, because I used to teach program outcome evaluations based on logic models. I used to teach as adjunct faculty at Harper College. I've been a grant maker and a grant seeker. I think that those kinds of skills are very important at the mental health board. So that being said.
Yeah, and you're absolutely correct. You have a wealth of knowledge and experience and passion and compassion, and so I appreciate that. And we thank you for interviewing for both of these appointments, and we've got some deliberation.
Yes. And I want to thank everyone for the opportunity for me to be here. And I got to tell you, it's very different to be on this side.
It's more nerve-wracking to be an applicant. Yeah.
Well, thank you very much.
Thank you.
Have a great day.
Yes. You too.
Thanks. All right, it's 10:28. Let's take a 5-minute bio break, and we'll come back and deliberate.
All right.
always need layers in this place. All right.
We're okay. We don't have Tanya, but yeah.
Yep, here she comes. So, what I'd like to do with deliberations, I would like to, couple of things. I think we can all acknowledge we've got some hard decisions to make. And so what I'd like to do is, rather than starting with a motion, I would like for each of us to be able to maybe speak to, you know, if you had one to recommend, who might your one be? And see if we have three that kind of rise to the top. I want us to have an opportunity to speak to all the candidates, or the candidates that, you know, we might want to recommend, rather than starting with a motion of three and then not being able to talk about all of the candidates. So, Tracy?
I'll start. I guess the one person that I really did like was Amy Rath. I believe that having that outside perspective, you know, in a room full of so many other people who are immersed in, you know, the details of everything, but having that outside perspective of someone, you know, who can maybe see beyond the details and who can look at it from maybe the layman's person's point of view, and trying to help get the word out there and look for ways to make it maybe easier for people to get in touch with all of the programs. I think that's important to have. I think that's something that, you know, she could. Okay. So that would be my one person.
Thanks for helping us get started. Yeah. Jeff?
I don't disagree with what Tracy just said. The strong one for me was Lindsay. Just, I felt super strong, very diverse, understanding of business aspect and working in so many different areas.
Great. Thank you. Teresa?
I mean, it is hard to pick one, which is why we're glad we get to pick three. I also agree with Jeff about Lindsay Keisman, but I would also I'm going to put forward, Christina Bruhn is going to be if I only get one, I'm going to say Christina Bruhn. I liked her breadth of experience through different avenues of what the mental health board will be looking at, with program evaluation, with her clinical experience. I think that should be a real asset to the board.
Kay.
Yes, thank you so much, Lori. During the interview, you know, this whole process, one thing that came to me is that this is a particular culture, a particular segment of our community, you know, too, that is in the mental health industry. And what I see, you know, can happen, and it can be a danger on a board if you just put mental health practitioners because they have a great background, and that's all that you have on a particular board. And the diversity allows for thought, such as Amy, you know, who came up. And Amy, initially I put down a no because she didn't have the type of background. But then it occurred to me, she brought up a point, which I think, you know, I can validate a little bit. She didn't have the information she needed because she couldn't get it. You know, she didn't know about the mental health board. And frankly, you know, I experienced it despite the fact that we knew, you know, basically about the mental health board, but we didn't really realize all the resources that were available to us because it wasn't disseminated out into the public. So I think having more of a broad a broad base of people that have some knowledge about the mental health industry, but that could be challenging on the board a little bit to get the information out. I was very disappointed that Molly pulled her application. I thought Molly would be absolutely, excellent on something like this, to with her background, who could add to that. But anyway, that's my thought.
Okay.
Thank you.
Thank you. Tanya?
I have one question. Is there some other openings that are coming up in the future?
For mental health board?
Thank you. They're all so good, it's hard to pick, but then if we had some maybe future positions open, it would. Well, while I put Kathy on the spot.
That's all right, I'm ready. We have, the next openings are coming due in June of 23. And there's quite a few of them.
So would it'd be 4, right? It would probably, does it alternate that way? Like, because we've got 3 now.
3, 4. Yes, 4 in June 30th of 23. I'm sorry, I was looking at the Board of Health.
I was gonna say.
I'm bad, I'm sorry.
Oh.
That's not right. 12/31 of 24, 3 of them. My apologies.
24.
12/31/24, 3 terms. And then we have 2 terms, 12/31 of 25.
So
Besides,
got a while.
Okay, thank you. So I agree with everyone. I guess if I had to pick one, I would go with Kathy Ferguson, because she's been on the board. I think it's 10 years on the board, but then also it was important when she had mentioned the accountability and goals aspect that they had really brought forward, where she was saying, hey, the programs, we also need to really audit the programs and see if and prove that the efficacy of the program, that we're having the increase in resources and sort of having those checks and balances into seeing what programs are working and maybe what we could do to improve them, or maybe which ones aren't working. That would be my one, if I had to pick one.
Okay, and we can keep talking. I just thought we'd start with 1 because I figured, would that help us? But we'll.
Obviously not.
Well, yeah, and I don't want anybody, I want everybody to be able to, speak to their thoughts, but I thought at least we'd get started this way. So, Carolyn, did you have some thoughts?
Yeah, I had one. I did have one that I felt rose to the top for me. I thought everyone was really good, but the one in particular that rose to the top for me was Lindsay. I felt like she had the background in the mental health piece, but also the business aspect to it, so really understood, both perspectives of it, taking the mental health piece out, and then she's been a lifelong resident here, so obviously is passionate about McHenry County and has some experience, on other boards as well. So I just felt like she kind of offered a very well-rounded piece.
Okay. All right. So we had several we had a few that weren't spoken about. Is there anyone that would like to weigh in on any of the others that haven't been mentioned yet?
We could let Kay go first, I guess.
Oh, yeah.
But I also would like to speak too.
Go ahead, Kay.
Thank you so much, Lord. One thing, I would not, I would heavily consider Paula because of her background in seniors and in long-term care, and I think she would be an asset, especially with our Valley High. I think Paula, I think Paula should be on this mental health board.
And I echo that. So I also really feel like Paula should be on the mental health board as well. I realize that generally we get worried about putting somebody on too many commitments, but Paula has shown herself to be valuable on the mental health board as a liaison. And I think that I did name her as my top because I feel like we know her so well that we already probably came in, had a sense of how we thought she could further serve the community. But I really do think Paula has been an asset and will continue to be an asset to the mental health board.
I don't disagree with that, but it's also possible that it wouldn't be bad for her to take a break for a year and then get back on it in the next term either.
Thanks.
We had one name that came up a couple of times. Would we consider making a motion to appoint Lindsay to the mental health board? Or could I make a motion to do that?
Certainly. Go ahead. Go ahead, Jeff.
Make a motion to appoint Lindsay to the mental health board.
Okay.
Right. I definitely agree. I mentioned that I agreed. So.
Okay. So we'll vote. Roll call.
Ms. Bates?
I can't hear. I did not hear the motion. I'm so sorry.
Sorry, Kay. Jeff made a motion to recommend Lindsay for appointment, and Tracy seconded because Lindsay's name came up a couple of times.
Okay. Yes.
Ms. Von Bergen?
Yes.
Ms. Meshes?
Yes.
Schwartz?
Yes.
Schofield?
Yes.
Jindrak?
Yes.
Parrish?
Yes. Okay. Any other feedback regarding candidates? We haven't heard anybody speak to Rachel Boldman, if anyone had any comments, or regarding Mandy. If not, that's all right. I just want to.
I certainly appreciate Rachel's and continued interest in serving on the board, and I think that certainly she probably has offered significant assistance in her time, and of course I also appreciate Mandy wanting to serve on the board as well.
Okay, did you have anything additional you wanted to share?
Well, the only thing with Rachel, and maybe there again, I may not have heard everything that was being said, but Rachel Boldman has indicated that she is not necessarily as close to the students on a day-to-day level, where she is more in the administration, which would maybe her impact and her focus and her allowing us to know what's happening with the students as far as mental health is concerned might not be quite as there. I could be wrong though.
Thanks, Kay.
Amy's name came up a couple of times.
I don't disagree. I had her as one of my, actually, I'll be honest with you guys, I had Christina, Cathy, Paula, and Amy all were kind of my next pool of, which sounds like, everyone else was kind of in the same boat and for all different reasons. But I agree on Amy's perspective, and I was just talking to Lori actually at this because I totally can relate to it as a parent. And I have been trying to find out a way to actually get parents more educated and and available resources, or having them know what is available. My concern is I don't know that the mental health board is necessarily the best fit. Like I feel like there's got to be a way, and maybe Leo and I can follow up on a conversation because I think she's an excellent resource. I actually wrote down her number to follow up if we don't appoint her to it, to actually follow up with her, because I think that It is definitely a need. It's a void I've been trying to fill personally as well and figuring out the way. I'm not familiar enough with the mental health board to see if that is the best utilization in the way of doing it. I mean, I would love to see her active in it, but I don't know. I want to optimize, and if the board's it, great. I mean, I think that, you know, then that's awesome bit, and I would fully support that. But I don't know.
Right, I have to agree with Carol, and then I also think that she probably does have available insight, but maybe it's not with the mental health board part, but maybe there's some sort of community liaison role that can be used to help talk about how we can spread information and make it more accessible. But I don't know if her, I agree with you.
Yeah, I don't know. And if someone's more familiar with the board, I mean, I have to say the board activities, I'm not as familiar specifically with what, I know what the board as a whole does, but the board members themselves, if they have the opportunity to actually advocate and, you know, be productive in those resources, I don't know. Maybe somebody else knows more.
Would it be appropriate to ask?
Yes, I think in general, if you could speak in general to what Carolyn's asking, how, you know, the board, how, or Connie, you want to speak to Connie, how the board members are able to participate in communicating with the public and about what the Board of Health does, as well as the community agencies that are out there.
Board members should be able to communicate with the public. Any questions that are asked, and we have a great website that has all the agencies, and it is kept up to date. I just want you to know that, because somebody interviewed and said their website's not kept up to date, and it is. So I think you've got some really good candidates here. I have strong opinions on some, but you know, it's up to you.
Thank you.
So yeah, the board is able to, and we want board members to advocate. There's different ways that they can do that. You know, they have opportunities, speaking engagements in the community. As you know, we have the annual town hall, but outside of the boardroom, there's, you know, we count on our board members to be a voice and to help educate.
Great.
Could I ask a question?
Sure.
Would it be valuable to have someone on the board that wasn't in the mental health business, from the general public, that didn't have experience in that area? Would that be valuable?
Yeah, we wanted a diverse board. As you know, we had our list of attorneys, and you know, I know Molly backed out, but we do want a diverse board. So they don't necessarily have to have the mental health experience. We want the diversity on our board.
Thank you.
You don't want everyone to be a social worker. There's a lot of people on the board that have that.
And then I'll follow up with that and say then Amy, you know, would obviously be different than the others, and then, because I would put Christina, Cathy, and Paula all into the very experienced category. So then, for me, I mean, I support Amy, and then I pull from one of those other three. I don't know that I had a strong preference, because they were all really good.
Could I make a motion that we move Amy forward, since her name came up several times? Kay mentioned Amy, and Carolyn mentioned Amy. You mentioned Amy, didn't you?
I didn't mention Amy. I do see how her experience outside of mental health, but trying to access services is useful. But yeah, I didn't name her.
Jeff, if you can make a motion, if somebody wants to second it, we can vote and see how the vote lands.
I will.
Okay. Jeff, Jeff motion for Amy Rath, and Tracy seconded.
Yes.
Roll call.
Chintrick,
Yes.
Schwartz,
Yes.
Von Bergen,
Yes.
Schofield,
Yes.
Meshes,
Yes.
Bates,
Yes.
Parrish.
Yes. All right, so that's 2 out of 3. We've talked at least a little bit about the rest of the candidates. I don't know if anyone has additional insight on a particular one, or if someone would like to make a motion?
I'll just say as far as insight, well,
I know, it's hard.
I was gonna say
It's
Kathy
hard.
and Paula have obviously more specific experience to the mental health board because they've both been part of it. Christina, though, has experience on, I think, other boards, but not specific to the mental health board.
You want to make that motion?
Well, she didn't know which one. She didn't pick one. She didn't pick one.
Motion for all three of them, just split the time.
Right. There you go.
I don't have a strong preference between those, so if anyone else does.
I'll make a motion that we move Christina.
Yeah, no, now I'm conflicted, right? Because like I named Christina originally, but I really do think Paula should be on the board. That's my conflict. That's my conflict.
I just have, so I think Paul is absolutely amazing, and I don't think we could make the wrong choice here. The only concern I had was some of the mentions that Paula made about increasing the levies as opposed to some of the other candidates that said they were trying to sort of find ways to do what they could with the resources they currently had and sort of closing the gaps with what we have now as opposed to like any like increase, or that always concerns me when we're talking about increases in any type of tax or reallocation of funds. That was the only thing that kind of caught my eye, as opposed to some of like Chris, how she mentioned that there were like partnerships she was going through in order to really expand the programs with what they have. So I'm going to lean on the rest of you to help with.
Well, and if I can, thank you, Tanya, for that. So Jeff, were you making a motion for Christina? Is that what I heard? And
Well, I think this is a difficult decision.
It is.
We got all
Yeah.
these good candidates
Right.
here.
Right.
And the only way we can sit here and debate it all day.
I agree.
But
I
the
agree
other
with
way
you.
of doing it is just put a motion forward and vote on it, and if we disagree, then we just pick another one.
Exactly. Well, and that's why I wanted to.
So that's my thought is, I would
Right.
like to make a motion to move Christine forward.
Okay.
And
so
someone
then,
could second that.
right.
I will second it.
Okay.
And
Any other discussion about-
on that?
yes,
On her
yes, yes. Any
specifically,
dis-
looking back at my notes, I did have that, program evaluation, listening
Mm-hmm.
to Tanya speak, program evaluation was one of her strengths. And financing, she had mentioned, obviously being in the educational realm, I mean, that's always a huge factor.
Kay would like to speak.
So,
Thank you, Kellen. Okay. Discussion on motion for Christina. Or Chris, sorry, Chris.
My only concern with Christine is, that's our third vote. And I feel that we owe Paula an opportunity to get on the floor here and have a vote, yay or nay.
Do you think we should go through each?
Well, the motion's already been made.
Yeah, right.
Oh, that's true, I'm sorry, your motion's already on, I apologize.
no, I mean, I think that people can weigh in on.
Right, the motion's been made, so we can weigh in by vote if we feel that another candidate other than Chris is the third one we want to move forward. So, any other discussion? All right, so we'll vote on Chris.
Schofield,
Yes.
Meshes,
Yes.
Jindrak,
Yes.
Schwartz,
Yes.
Bates,
No.
Von Bergen,
Yes.
Parrish.
Yes. Okay.
That was literally the hardest one, I think, that,
Yep.
I think that it can be discussed at the COW too.
Yeah. Mm-hmm. Yeah, so
Oh,
those are the
yes.
three
Yeah, it's true. That's a good
recommendations.
point.
Yep, those are the three recommendations that the committee has voted to move forward. Chris Bruhn, Amy Rath, and Lindsay. All right, Lindsay
Keisman.
Keisman. All
And
right.
again, just if I can just add, they're all excellent. I
Mhm.
mean, I
Absolutely.
really appreciate and would encourage them all. I mean, like Lindsay, she had applied before, so I'm glad that she came back, and phenomenal candidates. I mean, their backgrounds are all amazing.
Now, Senior Services Grant Commission, right?
Yes. So
I'll make a motion for Paula Yensen to be appointed to the Senior Service Grant Commission.
I'll second that.
All right, all those in favor? Can we do all those in favor? Since there's only one there. All those in favor, say aye.
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 Any opposed? All right, there we go. All right, thank you, everyone. So, let's see, we've got 5:14, well, let's see, yeah, okay, so they're not separated. 5:14 is, deliberation and selection, no, we did that one. Sorry, I'm looking for, there it is, 6, sorry, 6.1, routine consent agenda.
Which is,
And it's our only
Great
one.
funding. Yep.
What's that? Anybody want to discuss it? I know I do. Briefly? Anybody else?
well, we'll discuss it, yes.
All right,
I agree, we'll
moms,
discuss
come
it.
on, moms. Thank you, Connie and Leo, for being here.
You got 3 new ones.
All right.
Thank you, everybody. Thank you, guys.
Thank you. Thank you very much for your time. Those recommendations will go to the board. All right, yes. All right. Hans,
Good morning.
good morning. Thanks for being here. Thanks for waiting.
Thank you. Thanks for having me.
All right. Can you share a little bit about where we're at with the allocation
Absolutely.
program?
Do we have to have a motion and second first?
I'll make a
Yes,
motion.
please.
I'll make a motion to discuss resolution authorizing senior services grant funding allocations for program year 2023.
Great.
To actually move it forward.
To move it forward.
To actually move it forward.
Oh, let's move it forward.
Yeah.
Right.
I will second.
Okay,
moving forward.
and now we'll discuss.
Technicality.
Now we'll discuss that with
What's
Teresa and
Okay.
Tracy. Thank you both.
Thank you. For the
Thanks.
record, Hans Mock, Community Development Administrator for McHenry County, and what you have before you today are the allocations that you all are part of the Senior Services Grant Commission. So these recommendations have been made by the commission to the county board for approval. Typically, as you heard in one of the earlier presentations for the Senior Services Grant Commission, we've tended to have around $1.645 million annually for the Senior Services Grant Program. We had a little bit more for interest payments that came forward, so we brought it up to 1.65, a little bit more than that. The recommendations are made to provide transportation services and services to prevent unnecessarily placing seniors into nursing homes prematurely. So that's the gist of it. I was just looking at some population stats, and our population of individuals who are 65 or older is now at 15.9%. We're seeing a lot more in the lower echelons of that category, from about 65 to 74 years old. I think it was like 11%, if I'm not mistaken, but then as the remainder of that would be over that age. So it's telling you our population is continuing to age. And so some of the other complicated things that you see among the population is that especially again in those younger ages of the senior population, is homelessness, or the potential to become homeless with rent burdens or tax burdens and things like that. So obviously there's a wide array of services here to assist our county residents, and we put those forward. But I'm here to answer any other questions you might have.
Any questions?
I'm looking over them again.
Most of us were on that committee.
We were on the
so
committee,
there
yes.
shouldn't be a lot of questions, really.
Yeah.
Right,
It was-
right.
It was a long day.
It was
Yes.
a long day, yeah.
I remember, I was not participating this year, just in terms of the shift in my professional situation, so I didn't want there to be any potential perceived conflict of interest. So I did let the chairs know and county administration know that I would not be participating. So but I do remember those were long days. I know, Carolyn, you weren't able
I was
to
not
be
able,
there,
yeah,
so
I
I
was out of
just
town.
didn't know if you had any questions or
Nope, good.
comments
I
or.
looked over it.
Okay.
and, Yep.
All right.
Their decisions.
And yes, I do as well. I'm excited. The only thing I wanted to say is I'm excited that there's conversation about looking at the Senior Services Grant Commission differently. Certainly with the board shifting from 18 to 24, there's going to be a lot of liaison positions that need to be filled, and I think to have the whole PHCS committee there may not serve the committee well or the grant commission well, given all of the other things that are going to need to be liaison, if that's a word. And then the other thing I wanted to say is I appreciate and respect the funding regarding transportation, but I'm also excited about conversations that are happening at PTAC, and I don't know if they're happening at the Transportation Committee itself, but just looking at McBride and the transportation, and I know last year I did not align with funding regarding the transportation for the Senior Services Grant Commission items, but I respect and honor all of your decisions on moving that forward. I'm just excited that those conversations are going to be happening and maybe sounding and looking a little bit differently. So I want to thank the committee for all of your work on the Senior Services Grant Commission, because I know it is a lot of time, and it's, again, a bunch of difficult decisions when you have more requests than you have funds available. So thank you for the time and work that you put into the funding on this year. So, all right. Kay, did you have anything regarding the Senior Services Grant Commission resolution? Nope. Okay. All right. So we'll go ahead and vote, as it is money.
Bates? Bates?
Yes, are we looking for a motion?
No, we're voting on the resolution to put forward the allocations for the board.
Okay.
So do you vote yes or no?
Yes.
Okay.
Meshes? Yes. Von Bergen?
Yes.
Schwartz?
Yes.
Schofield?
Yes.
Ginger?
Yes.
Parrish?
Yes.
All right, and I just wanted to say, on behalf of the Community Development Division, we've enjoyed working with this group. I think this is the last meeting we're having, if I'm not mistaken, so we've enjoyed working with all of you. Maybe we'll see some of you at the next Public Health and Community Services in the next couple of months. But thank you, Lori, and thank you, everyone, for your support of our division. We really appreciate it.
Thank you. Thank you for all your hard work.
Yes.
And your staff, too. Okay, so we have a discussion, and I'll just mention now that the Department of Health is not able to present this morning on the community resources, so we'll shift that one perhaps to a future meeting. And so I'd like to welcome the Pioneer Center for a brief update on the shelter, so come on up.
Good morning.
Good morning.
Good morning, everyone.
Thank you so much for being here and for your patience in our packed agenda this morning.
Good morning. Thanks for having us.
Could you please reintroduce yourselves? I know it's been a while since we've had a chance to connect and.
Yeah, my name is Frank Samuel, CEO of Pioneer Center. And Carrie, why don't you introduce yourself?
Absolutely. I'm Carrie Friend. I'm the Director of Homeless Services. I just celebrated my 20th year anniversary at Pioneer Center.
Okay.
So
Congratulations.
I just have to put that out there for myself.
I'm not anywhere close to that. I'm going on my 8th year at Pioneer Center. So.
Well, congratulations. Well, thank you for coming. We wanted to have an opportunity to connect about the homeless shelter. You may or may not know, it was last month, it wasn't last week. It was last month that this committee had a brief conversation about the efforts by administration and the Community Development Department to prepare for emergencies that arise during the cold winter months. And a couple years ago, we were kind of surprised by them and maybe caught behind the 8 ball. And then last year, Scott and Hans worked together to try and intercept the anticipated frigid temperatures of January, February, and then this year they came to us well in advance with a plan and community partners and collaboration. So with that, there was conversation around, let's hear how things are going at the homeless shelter, and I know that you've been navigating COVID, as we all have been, so we'd love to hear an update, and then any questions that committee members will have for you.
You want me to start?
Yeah, why don't you start?
Okay,
Thanks,
so I did
Carrie.
write some stuff down. To be honest, this topic that is being brought up today has been being talked about a lot. There's usually certain things that everybody is wondering about the shelter, and I'm trying to take more opportunity to be able to get out and talk about it, because to be honest, all of us that are working at the shelter, we're just so focused on the work and getting people out to better outcomes that I guess talking about it or bragging about it, it doesn't even really come to our minds. And I also know that, you know, there's people that think they know how we're operating and what we're doing at the shelter, so I think this is good, and I really do appreciate the invitation to be able to educate people on what's actually happening at the shelter. So what I would want to start out by is saying that in our Q1, which is July 1 through September 30, we have served 76 people at the shelter. 59 of them are adults, and 17 of them are children. We've seen an influx of families with children at the shelter, and we, up until, well, right around a month ago, we had more children at our shelter at one time than we served all of last year. Through great collaboration with partner agencies like Veterans Path to Hope and Home of the Sparrow, we were able to quickly house 3 families, including 11 children, very quickly into their programs, because the homeless shelter is not an ideal place for anybody, let alone small children. So we had our hands full when we had all those kids at the shelter. Anybody that's been to the shelter knows that typically, okay, so at the shelter we have a men's sleeping area, we have a women's sleeping area. The men's sleeping area is considerably bigger than the women's sleeping area, because up until recently we were seeing a lot more single men who were homeless. Well, when we saw this influx of children into our shelter and families, we had to start thinking to ourselves, what are we going to do to provide services, because we don't want to be turning kids away, you know, we don't want to be doing that. So we had even considered making our men's sleeping area the family and children's sleeping area, and having the men go to the women's side. You know, one thing we've learned to do is every room at PADS has to be a multi-purpose room, because, you know, we have people who are gender neutral that come into the shelter. We have to be able to be flexible and change things around at the drop of a dime, I mean, in all honesty. So another thing I would want people to know is that a lot of people think when we talk about the number of people that are served at the shelter, sometimes people think it's the same people all the time. When we say 76, that people think it's that same 76 people. It's not usually. We're having a lot of success getting people to more stable outcomes, more success than we've ever been having. And that's been great. So as quickly as people get out to more stable outcomes, we have people coming in. There's not usually any more, this is shocking to most people, there's not usually any more than 3 to 5 people or families on our wait list. And they're on a very short amount of time. And typically we will put people in our motel program until they can intake at the shelter. Average length of stay for people at the shelter is 72.5 days. That surprises most people, and that's not really that long for a homeless person. And we're proud of that number. That you know, we're getting people back on their feet really very quickly. The other thing I'd want you guys to know is that I know that when we bring up the topic of cold weather, and sometimes in the middle of summer when it's so hot, about 50% of the people that could use our services at the shelter choose not to. Even in a polar vortex, even in the middle of summer when it's so hot or when there's torrential downpour of rain, we still have 50% of the people that could use our shelter choose not to. And it's for a variety of reasons. Most of you around the table probably know the reasons. They either don't want to follow any rules. Some people just don't want to be in a shelter with 4 walls. Some people don't trust receiving services from any provider. And, you know, it's their choice. We do everything we can to bring people into the shelter. But there's a group of people that, you know, they just don't want to use the services for whatever reason. I don't really have any, I do want to talk about phase 3 construction. You might have talked about it.
Yeah.
You want to talk about it?
Why don't you tell them about the capacity and why we
Yep.
can't, serve at that full capacity?
Okay, so we have been operating all through COVID under the CDC guidelines. And right now, the CDC is looking at congregate living situations. They haven't made any new guidelines yet. When they do, we will be seeing what their recommendations are, and we will respond accordingly. So right now, we operate at half capacity. We have the ability to serve up to 70 people on any given night. We're operating at half capacity, but keep in mind, we don't have a list of 100 people waiting to get into the shelter. It's usually 3 to 5, and they're not going unsheltered. Okay, and then there's that 50% that aren't wanting to come in. So we knew that when we saw this influx of families with children too, we were at that half capacity. So Kim and I reached out to Frank and we said, we got to be able to serve more people. I'm not feeling good about turning kids away, like toddlers. Like this doesn't feel right. So we made a decision at the shelter that we weren't going to count the kids as far as our capacity count, because with children, with their families, they're able to sleep in a corner of, like, let's say the sleeping room. We don't have to have the beds spaced out, and they're able to be, you know, close to each other. So that's one thing that we did. So as soon as the CDC, though, changes their guidelines, we want to reopen our day center. We want to be able to increase capacity. From the numbers that we're seeing, I'm not sure if we're ever going to have 70 people all at one time at the shelter with the numbers we're seeing. Now, there are evictions happening, so we do anticipate an influx of people, but there's always going to be, and as long as I've been doing that, there's always been that 50% of people that don't come to the shelter, even though they could. I'd like to talk a little bit about the cold weather program, and I know there's been a lot of talk about it. We do have a cold weather program, and we're going to be able to, we don't just put people in the motels just for cold weather, though. We want to be able to have the ability to do that in a lot of different instances if people are waiting to get into the shelter, even if it's not cold out. So we do use it for cold weather, but we use it for a lot of other reasons too. If somebody at the shelter gets COVID, we isolate them in our motel program so that we can try to keep the people at the shelter safe, and that's been working real well for us. So as long as we have the funding to be able to do that, we're going to provide that service. The other thing I'd want you to know is that Pioneer Center is also part of those conversations about, you know, are there buildings somewhere where we could maybe have drop-ins for people who are unsheltered, you know, that maybe don't want to come to the pad shelter, but a place for people to be able to go. And we are a part of those conversations. There haven't, as far as I know, there haven't been any decisions made about that yet, but we're definitely a part of the conversation, and we definitely want to be a part of solving that problem. I'd be happy to answer any questions that you guys have, though.
Sure. Frank, did you want to speak to phase 3?
Yeah,
Quick, and then
yes, so they finally, we started phase 3 early October. The county through CDBG funding gave us $150,000 to finish that project.
And what's that project again?
So it's basically to add some offices, providers, staff offices, a family room, upgrade the floors. So it's not big. Phase 1 was the biggest, phase 2 was the commercial kitchen, and this one is the final phase. It'll make our shelter complete, a full service shelter.
Can I speak a little more to
Oh,
it?
absolutely.
Yeah, sure.
So I always have to share this story with everybody because when we first opened 2.5 years ago, we had the shelter designed a certain way, and as the director of homeless services, I was like, oh man, Frank, we can't just open this all at one time and all that, but it actually has turned out to be a blessing that we couldn't, because we have operated in the space for 2.5 years now, and it gave us the ability to go, oh, I'm really glad we didn't open it the way we designed it, because it wouldn't have been as practical as it's going to be now, because we were able to see, oh, we need this room for when we have this influx of families, and we need a place where a mom can rock her baby to sleep or breastfeed her baby in privacy or more privacy. And so it was really neat to be able to go, oh, this is what we need, and boy, am I glad it worked out just the way that it did, because now we think it's going to be exactly what we need it to be, and we're super excited.
Yeah, I think, it's doing it in phases. Obviously, it was a funding thing. We didn't have the $1.6 million up front, so we had to phase it out, get funding from the county, private donors, so it was kind of staged, helped us manage that better. The operating cost is also another thing I wanted to bring up. It's about a $1.2 million operating budget, so it's not cheap to run a shelter. 60-70% of that is staffing, and the rest is direct and admin cost. So it's 1.2. Running a kitchen is not cheap. It cost us about $350,000 to build a commercial kitchen. All the equipment, safety, food, all that, it's not cheap. And then to add 2 staff to run the kitchen, that's $125,000. So it's not cheap running a shelter. And we have a gap for fiscal '23 of about $100,000. Hopefully we can bridge that gap through some donations and some funding from the state and the county. So yeah, I mean, we are excited. I mean, we are I guess, Pioneer is the only provider that's in 3 different divisions of service: developmental disability, behavioral health, and homeless shelter. Puts us in a unique position. Also makes it tough for us to get funding, manage it, different funding streams, different challenges, outcomes. So makes us unique, but certainly puts us in a tough position, so especially now with the crisis, hiring the right people. With COVID, some of the CDC guidelines, those are challenges hopefully we'll overcome. But we'd like you to think about the 1.2 million and the funding, the gap we have this year.
Thank you. Any questions? Teresa, go ahead.
I do have a question. So I'm realizing I should have reached out earlier offline. A couple months ago, I ran into a homeless man and his sister, and he was talking about how he couldn't use the shelter because he had a dog. So what are you able to do for homeless people who have pets, and obviously the pets can't come into the shelter?
Yeah, I would love to say that I'd love to be able to serve them, because I'm a dog lover.
Yes.
Dog lover through and through. We do allow people to bring service animals to the shelter. We haven't seen any in McHenry, but we used to see them regularly when we were at our Woodstock location.
Okay.
And we would even consider emotional support animals in Woodstock. It wouldn't be ideal for them to be at the shelter, but we I would love nothing more, and I don't have a good answer for people who have pets. And I feel for them though, because I know if I was homeless, I probably would sleep in a tent or wherever I had to keep my dog with me. I wouldn't want to give my dog up. It's funny though that you bring that up, because I was at Neighbors in Need on not this past Friday, but the Friday before was at Willow Creek Crystal Lake, and there has been some conversation about homeless people with their animals, because that's one of the reasons that group of 50%, there's a good number of those people that won't separate from their animal to come to the shelter. I wish that I could tell you that I could support that right there at the chapel, but I can't. It's not our property. We lease 10,500 square feet of space from the chapel, but there are some providers that are talking about how can we foster animals or something so that people can get the services that they need to be able to get back on their feet. And I know even some people, some providers who have fostered animals for some homeless people in their own homes. So I would love to be able to do that. I wouldn't say there's a great plan in place for it right now, but it would be something.
It's something in your thoughts.
Oh yeah, for sure. For sure.
Because I realized that's his. When he was like, I can't go to the shelter. I have a dog, and I'm like, okay. Well, I tried to do a little bit of trying to find out what we could do for him.
Yeah.
And
foster, like a foster home would be the only thing that I can think of at this time, and that's hard to find too.
Or a doggy daycare that might be willing to board.
Yeah, it's definitely something that's being talked about recently though. Even there was a dog, Veterans Path to Hope had one of the homeless individuals had a dog who needed surgery, and they put a blast out on Facebook, and I actually donated to it because I moved to help animals.
Right.
And it got me thinking, I was like, oh wow, what about homeless people who have animals who need medical care and all of that? So my wheels have been really going ever since that happened, and just how animals play into all of it.
Okay. Any other questions from the committee? I've got a couple. So, Carrie, you mentioned, I'd like to circle back, so remind me again, so in an ideal world, full capacity is how many?
70 beds.
70 beds, okay. Okay, and then you mentioned the CDC guidelines. Can you help me understand a little bit more? Because it's my understanding like the medical mask, I don't know all the guidelines soup to nuts, so just help me understand the congregate living versus other offices, other medical facilities.
Yeah. The congregate, well, you know, when you go to medical buildings still, you have to wear a mask, you know. We're still taking temperatures at our shelter. We still, of staff and guests. We have testing available on site when needed. People still have to wear masks except when they're sleeping or they're eating. The recommendations for congregate settings hasn't really changed a lot. And when you go to the CDC and you look up homeless shelters, it says right on there that they're evaluating it right now. But they haven't made any determinations, and as soon as they do, they'll be posted. But I check it every day, because there's nothing I would love more than to be able to increase our capacity. But we've been operating at half, even keeping it real again. Remember, there's not hardly anybody on our wait list, so, and we're having a lot of success getting people into more stable housing. So unless something changes, I'm not seeing that we're gonna use all 70 beds, but maybe.
Okay.
You know?
Is there concerns?
No. I was just curious. You know, you mentioned the evictions. You know, and we've heard in a couple of meetings I've been in. You know, there was concern back in October. Well, at the end of September, October 1, that that hour of time when landlords may choose to evict. And so did you see, have you seen an influx of people who are coming to you regarding being evicted?
A little bit, but we haven't seen any more than like that 3 to 5 people or families on our wait list.
Mhm.
And even the families have slowed down a little. We were seeing some big families, big families.
Okay. And then, Carrie, I thank you for the kind of the data that you shared around who you're serving and how many, and wow, to hear, about the shift. I'm wondering, and it sounds like you may not have them now, and that's fine. You mentioned, you spoke a little bit about, that they're not the same people. So I'd love to hear maybe if, through an email.
It just means that, a lot of times, people in the community think the people that we're serving at the homeless shelter are this, the most chronically homeless people that never get out on their own, and they've been there the whole time we've been open, and, and there is always some out of that group that are there, but most of the people that we're serving at the shelter are just like all of us in this room. I mean, we've seen doctors, nurses, airline pilots, you name it, we've seen it at our shelter, and they're just there a very short amount of time, just long enough to get back on their feet.
Right.
So that those people those numbers that you hear are people that are, so when we say that we're serving, let's say 37 people at our shelter, it's not the same 37 that we were serving 4 months ago or 5 months ago.
They're unique.
Yeah.
Right,
So
the unique,
they're
unique guests, if you will. And so, I was just curious in terms of the 76 people, you said 59 adults, 17 children. So do those numbers make up that unique
Yeah, and
guests,
so
if you will?
even
Okay.
I could have even broken it down a little bit more. We had 34 men, 23 women, 2 gender neutral people at our shelter. So it just really, it's always different. And we're always having to look at ways how we can best serve, because, 1 month we might see a lot of single men. The next month we might see this influx of women with children, which is exactly what we saw. And it's much easier. It's getting more difficult because there's, places like Home of the Sparrow, they don't have a lot of openings either. So that becomes a county issue, a county-wide issue, when there's not enough places to put these families with children. But it ended up so far, knock on wood, it's been working out well. There's not a lot of places for single individual men to go from the shelter unless we find them an apartment, or they go into permanent supported housing in a group home, or it's harder to find a place for them.
Yeah. Thank you, and I appreciate it. And my questions are just come from a place of curiosity.
Oh yeah, I'm glad. I love questions.
Being involved.
I could sit here all day and talk if you want.
Well, we've been here all morning, so
I know.
I'd be happy. You've been hanging out with us this morning, but no, I appreciate it, because I think you're right. I mean, we hear, all of us sit at different tables, whether it's county tables or community tables beyond our county responsibilities, and just hear things about transportation and homelessness and high rent and evictions. And so, there's just so many layers to the onion that it's, and then certainly, Frank, you mentioned it, the number of dollars that, county has provided, mental health board has provided. And so just looking at, knowing that we've all been a part in some of those funding decisions, that, just to hear and be able to appreciate the work that you're doing and the collaboration. I mean, you mentioned Home of the Sparrow and Veterans Path to Hope. And so I appreciate hearing that, because we sit around those tables and we might not hear those things because we hear about the need or the gaps.
Yeah.
And so being able to hear from you about how you're serving those gaps.
And I think the 2 common things that come up are, well, the hot topic is usually eligibility criteria. And there's just really 2 things. We serve McHenry County residents. It doesn't mean that we never serve anybody outside of McHenry County. But we are there to serve McHenry County residents. We had a family of 11 from Lake County show up at our shelter, and for whatever reason, Lake County couldn't serve them, and we made the decision to bring that family into our shelter, and 3 weeks later we found them housing in Lake County, because they're going to get the best services possible in the county that they can prove that they're from. So, and then the other thing is we do a background check on people. We serve men, women, and children at our shelter. So we're not looking to screen people out of our shelter, though. We're really looking to screen them in. But some of the more violent related crimes, yeah, sometimes that might mean that somebody isn't going to be able to use our shelter. But we're always going to give them resources to get services. And yeah, a lot of times it's Rockford Rescue Mission or Pacific Gardens in Chicago. Those are like the two go-tos that you know, they don't really screen people. So.
And it's a safety thing, right?
Yeah.
So, and even with COVID, it's a safety thing. The transmission levels are still high. Lake County went to high last week. McHenry is still substantial. So substantial, high. That means we have to be concerned about that because you don't want to compromise the rest of the staff and the rest of their lives.
Right, right.
So we have to be careful.
Yeah. And speaking of staffing, you know, it sounds like the CDC guidelines are really the ones that are focusing on the numbers that you might be able to invite in. I realize maybe they're not there. How has staffing or just the workforce shortage, how has it impacted you guys?
The shelter or Pioneer?
The shelter.
I don't like to jinx myself.
Yeah, sorry.
Of course, we experience, you know, some of the same things that other agencies, other pillars at Pioneer are experiencing. We have a much smaller group. I'm very lucky. I have a great team. Awesome. And it gives me the goosebumps to talk about my team. I absolutely love them, and it's an honor for me to be their leader. They stay. They're very loyal. I don't know if Frank wants me to say this, but my staff are some of the least paid at Pioneer because of different funding streams, but they stay anyways. I have people that come to the shelter to work knowing that they're going to make less than they maybe did in another pillar, even at Pioneer. And many of my staff have experienced homelessness themselves, so it really makes them have empathy for people. And I'm very choosy about who I bring on to my team because I'm not somebody that, I always want to be focused on best services, and I don't ever want to just bring people in to fill positions. I've never done that, and I don't think I ever could, because I need somebody that really has a heart to serve. And I always joke about it. We're not getting rich doing this. We do it because we love to serve.
Yeah. Thank you. Thank you to you and your team. I know I've asked a lot of questions. Any other questions from the committee? Kay, did you have any questions for Pioneer Center?
I do not.
Okay.
I would always encourage any of you to reach out directly if you hear things, see things are being talked about. Don't ever hesitate to reach out to me directly. I love having this conversation. I'm just busy doing what I do, so but I've been trying to get out more and talk to people and get the exposure and stuff.
We'd love to see you at Network Council.
Yeah, I was there last Monday.
Okay, I was not. I rotate with one of my colleagues.
Yeah,
so.
Leo asked me to come, and I basically did the same thing because there's different groups that are really wanting to hear the same thing.
Excellent.
So, yep,
Great.
I was there.
Excellent.
Yep.
Well, I'm sorry I missed it.
It's
I'm
all
you're
good.
here. All right. Okay. Thank you so much.
Thank you.
Thank you. Thank you for your service, and good luck to all of you on Tuesday.
Thank you. All right. As I mentioned, the Department of Health will not be presenting this morning, and I don't know, any future topics in mind? You guys will come Tuesday.
No, I don't have a future topic, but can I just say something?
Absolutely.
Okay, I just wanted to thank you for chairing this.
Yes.
I know you've done a great job with this committee. I know that you were a little nervous at the beginning to take it on, but yeah, you've done a great job and kept us all in line, and so thank you for serving in the role and bringing the committee to the next level.
Thank you.
Yes.
Thank you very much. I've really enjoyed it, and I am gonna miss it in some ways.
You can apply for a position.
Like Carol said earlier, I'm gonna take a breath. I'm choosing to take a breath and step back and not fill my calendar with anything just yet. But I have really enjoyed being a part of this committee for my 4 years. I've appreciated your, your flexibility with my ability or inability to lead the committee. I want to thank you all for serving, and I wish you, those of you that are running, I wish you all the best of luck. Those of you that are not, I wish you all the best in the future. You too, Kay. Anything else for the good of the order? Anybody want to make a motion to adjourn?
I will.
All right, all those in favor?
Aye.
All right, anybody opposed? All right, thank you, everybody. We're actually out of here earlier than I thought we'd be, even though it was a really long